Hi, welcome back. I'm so glad you are continuing your medical terminology studies with Course 2, Hormones, Hearts, and Lungs. In this course, we will explore new medical terms related to the endocrine, blood and lymphatic, cardiovascular, and respiratory systems. But first, some fun facts. Iodized salt was created to help treat the endocrine system disorder known as a goiter, which is caused by an iodine deficiency. Did you know that cows have over 800 blood types? Humans have 8. Myocardial infarctions, or heart attacks, happen most often on Monday mornings. It's true. Did you also know that you lose just over half a fluid ounce of water an hour simply by breathing? This explains part of the reason why you weigh less in the morning, unless you snack in your sleep. Such riveting stuff! And with that, have fun working your way through the endocrine, blood and lymphatic, cardiovascular, and respiratory system modules. Keep breathing. It will help. Welcome. I hope you are as happy to be here as I am. In this lecture, we will begin our exploration of medical terminology as it relates to the endocrine system. Let's get started. The endocrine system balances functions of the body. Endocrine organs secrete chemicals known as hormones into the bloodstream to travel to other organs or cells to cause them to change what they are doing. Fun fact! Most of the hormones made in the body are similar in both humans and other mammals. That's why insulin from cows and pigs also works in humans. Because there are many glands in the endocrine system, we will look at the purpose, anatomy, and roots for them together for this lecture. But first, let's look at this adorable calf, since we just learned they can share their insulin with us. Aww. The overall function of the endocrine system is to maintain homeostasis. In other words, it helps keep your body in balance. It can do this by using hormones to adjust nutrient levels, respond to the environment, and even direct growth and development. Fascinating! Endocrine system organs function by sending and receiving signals to and from other organs through the bloodstream. Target organs can then change their behavior to maintain homeostasis. For example, we can revisit insulin. Insulin helps regulate blood sugar. When there is a lot of sugar in your blood, it stimulates the pancreas to release insulin to lower your blood sugar and keep it within an acceptable range. Before we look at the anatomy and specific glands in the endocrine system, I thought it might be helpful to outline the general flow of information or hormones. The root hormono means hormone. Generally, the hypothalamus sends hormones to the pituitary gland, which then sends hormones to other endocrine glands like the thyroid or adrenal glands. It's kind of like the telephone game you might have played when you were a kid, where one person whispers something to the next and on down the line, but hopefully with a little more consistency. The hypothalamus is key in the endocrine system. Thus, it is also key in maintaining homeostasis. Specifically, it controls your body temperature. The hypothalamus is also responsible for other drives like thirst and hunger. It is also involved in sleep patterns and emotions. I like to think of the hypothalamus as your body's thermostat. The pituitary gland is actually two fused glands, the anterior pituitary, which makes its own hormones, and the posterior pituitary, which stores hormones made in the hypothalamus. The roots pituitaro and hypophysio both mean pituitary gland. Example anterior pituitary hormones include adrenocorticotropic hormone, or ACTH, and thyroid stimulating hormone, or TSH. These hormones then incite changes in the adrenal gland and thyroid gland, respectively. The pituitary gland is often called the master gland because it controls so many other endocrine glands. I like to think of it as a puppeteer pulling all the strings of its little puppets. Dance, little glands, dance. And now for a brain break. One endocrine gland under the control of the master puppeteer is the thyroid gland. The roots thyroid and thyroido both mean thyroid gland. The thyroid gland is responsible for the body's metabolism and metabolic rate. Perhaps you've heard someone say that they have a high metabolism, or more likely, a slow metabolism. If it is clinically too high or low, this is referring to hyper and hypothyroidism respectively. Signs and symptoms of hyperthyroidism, or oversecretion of thyroid hormones, include things like weight loss, feeling warm or overheating easily, and excess energy, which can come across as nervousness or feeling jittery. Signs and symptoms of undersecretion of T3 and T4 include the opposite, with weight gain, feeling chilled or cold all the time, and decreased energy, which presents as fatigue or feeling tired. That couch and comfy blanket look too inviting. Another endocrine gland is the pancreas. Pancreato is the root for pancreas. The pancreas is primarily known for its role in regulating blood sugar through the hormones insulin and glucagon. Insulin lowers your blood sugar after a meal, and glucagon does the opposite and raises your blood sugar between meals. Balance! Aren't we amazing? Wow. Finally, your adrenal glands sit on top of your kidneys like little party hats. The root adreno means adrenal gland. They have two main parts, the inner medulla and the outer cortex. The inner medulla is responsible for releasing the hormone epinephrine, better known as adrenaline. This fight or flight hormone is useful for helping you survive life-threatening situations, like getting attacked by a shark or public speaking. The outer cortex of the adrenal glands manufactures several hormones called corticosteroids. Cortisol, or the long-term stress hormone, is made here. It helps you survive prolonged periods of stress, like college or adulting. Here are a few extra roots related to the endocrine system. They include gluco, glucoso, or glyco for sugar. Crino is another root for gland. Cortico refers to the outer surface or cortex, and gonado refers to the gonads or sex organs. Finally, these suffixes are also commonly used in endocrinology. Tropin is a suffix indicating the hormone stimulates the release of another hormone. Emia refers to something in the blood, and urea refers to something in the urine. As with all good things, this lecture too must come to an end. Thanks for exploring introductory terms and roots related to the endocrine system with me. See you next time. Welcome! In this lecture, we will discuss some common medical terms related to the endocrine system that you might find in the subjective portion of an endocrinology note. Recall that subjective terms are those that the patient reports to the healthcare provider. They are the reason why the patient wants to see the endocrinologist. Most often, patients will not seek out an endocrinologist directly, but rather will be referred by another healthcare practitioner. Endocrinologists treat hormone imbalances. This will most commonly apply to complaints related to metabolic and reproductive disorders. Remember, these terms are not a particular diagnosis in themselves, but rather symptoms used to generate a forthcoming diagnosis. The first term refers to a general complaint of pain in a gland, or adrenalgia. Another common complaint that someone might make to an endocrinologist relates to adrenal virilism, or the premature or unwanted development of male secondary sex characteristics like lowering of the voice and facial hair. This is caused by an oversecretion of the androgens, or male sex hormones, by the adrenal glands. I don't know about you, but this guy looks a little young for that mustache. But those shades, on the other hand, are smoking. While adrenal virilism refers to widespread development of secondary male sex characteristics, hirsutism refers more specifically to an excessive body and facial hair growth in females. In addition to general complaints, some patients may complain about issues related to the pancreas regarding blood sugar or issues related to diabetes. Recall that the pancreas is responsible for blood sugar regulation through the hormones insulin and glucagon. The first complaint related to the pancreas is hypoglycemia. Hypoglycemia can cause shaking, dizziness, rapid heart rate, and irritability or confusion. Hypoglycemia can be common in people with diabetes, so most diabetics keep glucose tablets or hard candy with them at all times to combat hypoglycemia. Two of the main signs of diabetes are an excessive thirst, or polydipsia, and excessive hunger, or polyphagia. Through different mechanisms, the body thinks you need more food to increase blood sugar, causing the increased hunger, and can become dehydrated, causing the increase in thirst. Often, parents notice these symptoms in their children, which will raise initial concerns for diabetes. Please note that polyphagia and polydipsia are clinical abnormalities, not the usual increase in appetite and thirst that you might see with active and growing adolescents. In fact, I might need a second mortgage to feed my 2 teenagers for the next 5 years, and their friends. Closely related to the polydipsia seen in diabetes are complaints of polyuria, or excessive urination. Although other diagnoses like urinary tract infections can also cause polyuria, this is another sure sign that you might need to see an endocrinologist to rule out diabetes. Aww. And now for a brain break. Another gland which can cause subjective complaints in patients is the pituitary gland. Let's explore some of these issues that might bring someone to the endocrinologist. One of the hormones that is secreted by the pituitary gland is growth hormone. Obviously, hypo or hypersecretion of growth hormone will affect normal growth and development. If too little growth hormone is secreted during childhood and adolescence, pituitary dwarfism or abnormally short stature will occur. On the other hand, a hypersecretion of growth hormone will result in pituitary gigantism or abnormally tall stature. If the hypersecretion of growth hormone occurs after puberty when normal growth is finished, the resulting complaint might be acromegaly. Acromegaly results in abnormally large extremities, including the face, hands, and feet. Continuing our discussion, here are some common complaints related to the thyroid gland that might be in the subjective part of an endocrinology note. One of the more noticeable endocrine complaints is an enlargement or swelling of the thyroid gland, more commonly called a goiter or thyrocele. Goiters can be caused by hypo or hyperthyroidism and even thyroid cancer. Fun fact! One famous TV personality actually had his life saved by a fan. One viewer, who just so happened to be a nurse, observed the formation of a goiter over the course of the season of their show. They managed to get in touch with his producer with their concerns, and upon following up with his doctor, he was diagnosed with thyroid cancer and successfully treated. So perhaps watching TV saves lives? Let's all save lives! A second noticeable complaint related to the thyroid gland is exophthalmos. This condition results in a bulging or protrusion of the eyes out of the eye sockets. This is a characteristic sign of hyperthyroidism and can be seen in conditions like Graves' disease. Our final complaint relates to the reproductive glands or gonads. One common complaint that might send someone to the endocrinologist is amenorrhea, or a lack of a menstrual cycle in females between puberty and menopause. While some people might say amen to amenorrhea, this is actually a cause for medical concern, particularly if you are trying to become pregnant. Amenorrhea is common in elite female athletes undergoing rigorous training and with little body fat. It is part of the female athlete triad, which can lead to health consequences later in life, including osteoporosis. Notably, amenorrhea is normal during pregnancy and a desirable sign that all is going well. Bake on, little bun. See you in 9 months. As with all good things, this lecture too must come to an end. Thanks for exploring subjective terms related to the endocrine system with me. See you next time. Hello, it's good to see you. In this lecture, we will discuss some common medical terms related to the endocrine system that you might find in the objective portion of a medical record. Recall that objective terms are those that the practitioner will observe or discover through labs and tests. They are used to describe what the practitioner finds in their examination. Most objective endocrine terms are related to blood or urine tests. Often, the healthcare provider will assess the endocrine system through a blood test. Remember our suffix emia? That's the one. One common test that an endocrinologist might order is a blood test to test for blood sugar levels. Euglycemia means good or normal blood sugar, hyperglycemia is high blood sugar, and hypoglycemia is low blood sugar. Of note, just because a person has high blood sugar does not mean they have diabetes. Steroid use and illness can also cause this condition. Hypercalcemia indicates that you have high levels of calcium in your blood. This can be caused by overactive parathyroid glands. Having prolonged hypercalcemia can lead to weak bones, the development of kidney stones, and even cardiac and brain function issues. As with hypercalcemia, hyperkalemia also indicates above normal levels of an element in the blood. Hyperkalemia, though, refers to too much potassium. Symptoms of hyperkalemia include gastrointestinal complaints like stomach pain, diarrhea, nausea, or vomiting, as well as heart issues like chest pain or irregular heartbeats and even muscle weakness. Prolonged hyperkalemia can lead to a heart attack if left untreated. Hyperkalemia can be caused by some medications or indicative of endocrine disorders like diabetes or Addison's disease. Hypernatremia is another abnormal blood concentration term, this time meaning a blood sodium level that is above normal. Hypernatremia is usually caused by dehydration. Symptoms include thirst as well as neurological symptoms like muscle spasms and even confusion or seizures, as sodium is key to nerve function. Notably, hypernatremia at extreme levels can be fatal. Salt poisoning requires an excessive intake of sodium chloride. However, overdose is much easier in young children. Even a teaspoon of table salt can be fatal to infants and young toddlers. Homemade Play-Doh, soy sauce, or home remedies using salt water can all be potentially poisonous if enough is ingested. Please be careful and keep salt out of the reach of children. Your blood's pH should range between 7.35 and 7.45. Under normal homeostatic conditions, this proper pH range is maintained. However, endocrine system disorders can cause deviations out of the acceptable range and result in acidemia, or acidic blood, or alkalemia, or alkaline blood. Neither option is good, so just try to keep that pH in balance. Thanks, endocrine system. Two other abnormal blood test results include hypercholesterolemia and hyperlipidemia, meaning elevated cholesterol and fat in the blood respectively. They are risk factors for cardiovascular disease, among other unpleasant options. But I love cheeseburgers. All things in moderation. Or maybe offset that cheeseburger with some fruit, or a salad, or a fruit salad. Look at those happy hearts. Kiwi, yum. Aww. And now for a 10-second brain break. Look at the baby sea turtle. High five, little guy. Another method of assessing the endocrine system is through a urine test. These tests are non-invasive, which is a plus, and usually have names that end in the suffix urea. The first urine test we will discuss involves looking for calcium in the urine. Calciuria is the presence of calcium in the urine. This is not necessarily an abnormal finding, as we always have some calcium present in our urine. However, hypercalciuria is an abnormally high level and can indicate the presence of kidney stones.
Ouch!
I got those for my 36th birthday. Calciuria and a kidney stone. Happy birthday to me. The next urine test is not checking for calcium, but rather checking for sugar. Glucosuria is the presence of sugar in the urine. Unlike calcium, it is never normal to have sugar in your urine. Any amount is an abnormal finding and could be indicative of diabetes. First, a fun fact. Did you know one of the original tests for diabetes was to taste the patient's urine?
Ew, gross!
A sweet taste indicated sugar in the urine and a positive test. Wonder how many people interviewed for that job. The final urine test we will discuss is looking for the presence of ketones in the urine. Ketonuria is a sign that the body has switched to burning fats over carbohydrates in the body as a source of energy. This can happen as a result of diabetes or from low or no carb dieting. Finally, let's finish up by looking at some other objective terms related to the endocrine system. Adenomegaly is a term meaning enlargement of a gland. Recall that a goiter is a specific name for an enlarged thyroid gland. Adenomegaly is a more general term and can refer to enlargement of any gland. Another term, endocrine, means to secrete internally. Endocrine glands secrete their hormones directly into the bloodstream. The pancreas, which makes insulin and glucagon, is an example of an endocrine gland. The opposite of endocrine is exocrine. An exocrine gland is one that secretes its substances not directly into the bloodstream, but rather using ducts. No, not ducks. Ducts. Sweat glands are an example of exocrine glands. Fun fact, the pancreas has both endocrine and exocrine functions. Fascinating. Endoscopic retrograde pancreatography. Say that 5 times fast. Seriously, do it now. Well done. An endoscopic retrograde pancreatography is a procedure that uses an endoscope to look at the bile ducts and pancreas. They can be done before or after gallbladder surgery to remove gallstones. As with all good things, this lecture too must come to an end. Thanks for exploring objective terms related to the endocrine system with me. See you next time. Welcome. Thanks for joining me today. In this lecture, we will discuss some common medical terms related to the endocrine system that you might find in the assessment portion of a clinic note. Terms associated with assessment are used when the healthcare provider has gathered the patient's subjective information and his or her objective information. With the endocrine system, the assessment section will most likely contain diagnoses related to over or under secretion of hormones. Endocrine disorders are usually related to a tumor or inflammation of a gland. Let's take a look at some of the diagnoses that are more commonly seen. Our first medical term that you might find in the assessment section of an endocrinology note is adenopathy. Adenopathy means disease of a gland. This is a broad term that could be used with any gland in the body. Building on adenopathy, our next term is polyadenopathy. It literally means a disease of many glands. That's obviously what this person has. Just kidding, I have no idea what they have, but they do look like they could be really sad about all of their glands having a disease. Or they just realized this lecture has only just begun and there's still dozens of slides to go. Don't worry, we'll get through it together. An adenoma is a tumor of a gland. Once again, this is a general term that could be applied to any gland. There are also more specific terms that apply to a tumor of a particular gland. I will give you an example a bit later in lecture. See? Now, aren't you glad you get to stick around? Dysmetabolic syndrome is a combination of risk factors that include insulin resistance plus cardiovascular disease risk factors like a large waist circumference. This disorder is very common with over 3 million cases in the U.S. alone every year. Dysmetabolic syndrome significantly increases your risk of having a heart attack or stroke and should be treated under the care of a physician. Treatment usually includes weight management, exercise, and smoking cessation if needed. In other words, eat healthy, move your body, and don't smoke. This next term is one of my favorite med terms. Why? Because it's just fun to say. Thymoma. Try it with me. Thymoma. See? Super fun to say. Unfortunately, not super fun to have. A thymoma is a tumor of the thymus gland. I told you I would give you a more specific tumor term. The good news is, if the cancer is isolated to the thymus, the 5-year survival rate is above 90%. Insert preventative care plug here. Our next disorder is adrenal insufficiency. Also known as Addison's disease, adrenal insufficiency results in insufficient secretion of all adrenal gland hormones, including cortisol. During times of prolonged stress, the insufficient cortisol response can cause a hypotensive crisis. Symptoms of adrenal insufficiency include fatigue, nausea, darkening or bronzing of the skin, and orthostatic hypotension or dizziness upon standing. And now for a brain break. Moving on, we will now look at some assessment terms specific to the pancreas, which is of course both an endocrine and exocrine gland. As with any itis, pancreatitis is an inflammation, specifically of the pancreas. Pancreatitis can have a sudden onset and last for a brief period of time, or it can be a chronic condition that lasts for years. Gallstones and alcohol abuse can both cause pancreatitis. Symptoms include pain in the upper abdomen as well as nausea and vomiting. Perhaps the most common endocrine disorder, and definitely the most common pancreatic endocrine disorder, is diabetes mellitus or diabetes. Diabetes is a disease that causes difficulty regulating your blood sugar levels. Type 1 diabetes is an autoimmune disorder that damages the pancreas and prevents it from making insulin. Type 2 diabetes results in the body being resistant to its own insulin and is often related to obesity. Diabetic ketoacidosis is a serious complication of diabetes. When the body does not have enough insulin, it switches to burning fat for fuel, which results in the production of ketones. These ketones then cause the pH of your blood to drop to dangerous and even life-threatening levels. Classic symptoms of diabetic ketoacidosis include fruity scented breath and confusion. Finally, let's look at some common diagnoses related to the pituitary and thyroid glands. Can't wait? Me either. Pituitary infarction, or death of the pituitary, is usually related to a pituitary tumor. Symptoms include a sudden onset headache, paralysis of eye movements, and decreased consciousness. Treatment usually involves surgery and potential hormone replacement therapy. RIP pituitary. Hyper and hypothyroidism are over and under secretion of thyroid hormone. Hyperthyroidism results in an increased metabolism causing weight loss, increased sensitivity to heat, and excess energy as nervousness or feeling jittery. Hypothyroidism is the opposite with too little thyroid hormone. Resulting symptoms include weight gain, sensitivity to cold, and decreased energy or fatigue. As with all good things, this lecture too must come to an end. Thanks for exploring assessment terms related to the endocrine system with me. See you next time. Hello, nice to see you. In this lecture, we will discuss some common medical terms related to the endocrine system that you might find in the plan portion of a clinic note. The plan is used to treat the condition of the endocrine system. For the endocrine system, treatments are fairly straightforward. If the hormone level is too low, the hormone will be administered. If the hormone level is too high, medication can destroy part of the overactive gland or surgery can remove it altogether. The main surgeries for addressing oversecretion of a hormone involve removal of part or all of a gland. Therefore, they will usually end in the suffix ectomy. Here are a few examples. If you learned the word roots for the endocrine system, these surgeries are pretty simple. Yay! All of them mean removal of something as per the shared ectomy suffix. But just what are we removing? Adenectomy is removal of a gland. Thymectomy is removal of the thymus. Adrenalectomy means removal of the adrenal gland. Pancreatectomy means removal of the pancreas. Hypophysectomy means removal of the pituitary gland. Parathyroidectomy means removal of the parathyroid gland, and thyroidectomy means removal of the thyroid. Please note that after removal of a gland, hormones can still be delivered to the patient for normal functioning through medication. Beyond hormone administration and surgery, there are a few other treatment options specific to the endocrine system. Let's take a look at a few of them. The ketogenic diet is a high-fat, low-carbohydrate diet used to enhance the production of ketones as fuel for the body. It can be used to treat disorders like diabetes and other endocrine diseases, but should be done under the supervision of a physician. The advantage to such diets include weight loss and the potential to positively influence hormonal balance, but more studies are needed to assess the long-term effects on health. For people with type 1 diabetes, an insulin pump can be surgically implanted under the skin, which will allow for a continual release of insulin directly into the bloodstream. Continuous subcutaneous insulin infusions prevent repeated insulin injections and can monitor blood sugar levels more closely, thus helping better manage the disease. Sometimes small stones can form in the pancreas from hardened digestive juices. As they move, they can clog the ducts leaving the pancreas. A pancreatolithectomy is a surgery to remove the stone, thus reopening the flow of digestive juices from the pancreas to the small intestine. As mentioned, the plan for treating endocrine disorders is fairly simple: supplement low hormones and lower high hormones. Therefore, this lecture is also relatively simple. And on the note of digestive juices, how about a daily dose of cuteness? And as with all good things, this lecture too must come to an end. Thanks for exploring plan terms related to the endocrine system with me. See you next time. Welcome! Thanks for joining me again today. Are we having fun yet? In this lecture, we will begin our exploration of medical terminology as it relates to the blood and lymphatic systems. Woohoo! The blood and lymphatic systems are a transportation system designed to bring oxygen and nutrients to tissues, remove waste, repair injuries, and fight infection. Together, they are quite the dynamic duo. Like peanut butter and jelly.
Yum.
And lions and kids. Just kidding. Don't let your kids play with lions. Even their blood and lymphatic system dynamic duo can't fix that injury. Let's begin by looking at the blood. We will review basic anatomy as well as new word roots. Erythro means red, and erythrocytes are your red blood cells. They contain the protein hemoglobin that carries oxygen from the lungs to the tissues in the bloodstream. Fun fact! Erythrocytes are anucleate, meaning they don't have a nucleus. Once the cells mature, they hit the eject button and expel that pesky nucleus to become big bags of floating hemoglobin. Kind of like that red, annoying passenger eject button in your car. Wait, your car doesn't have one of those? Mine either. Leuco means white, and leukocytes are your white blood cells. They serve as a part of your immune system, working to protect you from foreign invaders and pathogens. Specific types of leukocytes include lymphocytes, eosinophils, neutrophils, and basophils. An elevated leukocyte count can indicate the presence of an infection as your body multiplies and mobilizes your defense system. Leukocytes are kind of like your own army against disease. Take that, fast food that was dropped on the floor before it was delivered through the drive-thru window. The root thrombo means to clot, and thrombocytes are your clotting cells or platelets. When a blood vessel is injured, the jagged-edged platelets stick to the wound and help form a clot to prevent massive blood loss or hemorrhage. Now for some new word roots. We will start with one related to thrombocytes or platelets. The first root is coagulo, which means coagulation. Coagulation is when a liquid, like blood, turns into a gel or semi-solid and can form clots. You can see it in words like anticoagulant, which is a blood thinner. Our next few new roots refer to more general blood-related terms, including the most basic, hemo or hemato, which both mean blood. You can see them in words like hemophilia, which is a blood disorder, and hematology, which is the study of blood physiology. Fun! Even more general, the word root cyto simply means cell, but not this cell, this cell. Cyto means cell. Finally, phlebo and veno both refer to the blood vessels known as veins. You can see them in words like venipuncture, which is a puncture of a vein to draw blood, and phlebotomist, which is a person who takes blood for a living. Or as they are also affectionately known, vampires. And now for a brain break. For the second half of this lecture, let's look at the lymphatic system in more detail. Much like a wet, dry vacuum can remove extra liquid from carpet and spills, the lymphatic system serves to pick up extra fluid which is leaked out of the blood vessels and into the tissues. It then transports this fluid back toward the main veins and the heart. The other function of the lymphatic system pertains to its role in immunity. There are leukocytes and antibodies in lymphatic fluid, and lymph nodes act as filters throughout the body to help strain out foreign pathogens and invaders. That's why they swell when you're ill, because they become clogged with pathogens. I like to think of them as a colander, straining out all the things trying to make me sick. But not cucumbers like we see here. Cucumbers are good for you. Now for new word roots. Lympho means lymph. Lymph is a colorless fluid which bathes tissues and moves through the lymphatic system back into the bloodstream. You can hear it in the name of the lymphatic system itself. Myelo means bone marrow. Bone marrow is in this discussion because it's where erythrocytes, leukocytes, and platelets are made. Perhaps this is why broth made from beef bones and roasted bone marrow, like that pictured here, is a home remedy for anemia or a low red blood cell count. The word root tonsillo means tonsil. Your tonsils are lymphoid tissue and part of the immune system. The palatine tonsils are probably the most well-known tonsils and are located at the back of your throat. They are the first line of defense against bacteria and pathogens that enter the body through the mouth. Say ah. Spleno means spleen. The spleen makes lymphocytes, filters the blood, stores red cells, and destroys worn-out red blood cells. It is the largest organ in the lymphatic system and can become life-threatening if ruptured as blood pours into your abdominal cavity. So how does one rupture a spleen? Car crashes. Always wear your seatbelt low and across your lap, and drive carefully, people. Never text and drive. Look at me slipping life advice into medical terminology. You're welcome. Our next word root is immuno. Meaning immune system, it refers to our body's natural defenses against disease. Looks like this person had immune system failure. It happens. To close, here are a few other roots and suffixes related to the blood and lymphatic systems. Thymo means thymus gland. Emia means blood, and penia is a deficiency. As with all good things, this lecture too must come to an end. Thanks for exploring introductory terms and roots related to the blood and lymphatic systems with me. See you next time. Greetings! In this lecture, we will discuss some common medical terms related to the blood and lymphatic systems that you might find in the subjective portion of a clinic note. Recall that subjective terms are those that the patient reports to the healthcare provider. They are the reason why the patient wants to see the healthcare practitioner. In the case of the blood and lymphatic system, bruising, fatigue, or swollen lymph nodes are among the more common complaints. Once again, we will split our subjective terms into blood and lymphatic complaints. We will start with hematological complaints that might cause a patient to seek out medical care. Generally, these complaints are the result of low blood cell counts from a deficiency in erythrocytes, leukocytes, platelets, or a combination of the three. Our first subjective term is anemia. Anemia is a broad term that means a low erythrocyte or red blood cell count. There are many different types of anemia, including sickle cell anemia, hemolytic anemia, and the more common iron deficiency anemia. Low erythrocyte count means less hemoglobin to carry oxygen to your tissues and results in the characteristic feeling of fatigue. As you can see here, the person on the right would be more likely to have anemia-related fatigue than the person on the left. Or they just wanted an excuse to snuggle. No judgment. A petechia is a small bruise. The plural of petechia is petechii, which is a cluster of multiple petechia. They are usually red, brown, or purple in appearance and are the result of broken blood vessels beneath the skin. They can happen as a result of straining, like when you vomit, cough, or lift weights, or even be a side effect of medications like penicillin. Or the result of falling asleep on something like this. Ouch! While a petechia is a small bruise, its larger counterpart is called an ecchymosis. This is the term for that bruise you get when you bump into a desk or table corner or you drop a hammer on your foot. The discoloration results from broken blood vessels leaking blood under the skin. As the hemoglobin in that leaked blood is broken down, it causes the change in colors as the bruise heals. Pretty. And what a cool word, ecchymosis. Rhymes with Becky Jo's sis, as in, do you know Carol? Of course, she's Becky Jo's sis. While an ecchymosis is usually flat, a hematoma is a raised blood-filled tumor or mass. Hematomas are most often the result of trauma, like the biceps tendon damage seen here. Hemophilia is a blood disorder characterized by excessive bleeding due to poor clotting ability. Of note, hemophilia was once called the royal disease because it ran rampant in the royal families of the 19th and 20th centuries. From Queen Victoria in England, it spread throughout marriage to Spain, Germany, and Russia. An X-linked recessive disorder, it manifested almost exclusively in male heirs, with females serving as carriers. People with hemophilia can experience severe hemorrhages from simple cuts and bruises that people with normal clotting don't sweat. Treatment with injections of plasma or clotting factors can help, but there is currently no cure. So go cure it. Maybe it's your destiny. Speaking of hemorrhages in people with hemophilia, a hemorrhage is an excessive loss of blood from damaged blood vessels. Hemorrhages are obviously life-threatening and can cause circulatory collapse from inadequate blood volume in the vessels. However, I'm pretty sure the hemorrhage pictured here is just ketchup. One of my sons got in the car after school this week and announced we needed to go straight home because he was hemorrhaging from a torn cuticle on his fingernail. He wasn't. A simple bandage did the job. I don't know where they get the hyperbole and dramatic arts from, but he did use the medical term correctly. His mom must be a professor or something. So proud. Aww. And now for a 10-second brain break. Hi, horsey. In addition to hematological complaints, complaints related to the lymphatic system can also bring a patient into the clinic. These complaints are usually related to swollen lymph nodes or edema of the extremities. Our first medical term related to the lymphatic system is lymphadenopathy. Lymphadenopathy means a disease of the lymph gland or node. This is a general term for any lymph node and generally causes swelling of the node itself. This is why the practitioner will often palpate under your jaw, behind your neck, and even in your abdomen. While lymph nodes are spread throughout the body, this is where most lymph nodes are clustered. And now for story time with Kabiri. Once upon a time, there was a handsome prince who just so happened to be bald. One day, he was sitting on his royal throne looking terribly sad. When the queen asked him why the long face, he solemnly replied he thought he had a brain tumor. As the queen had some basic medical training, she did not overreact or even call the royal physician, but rather sat down to ask him more. Upon further examination, the handsome prince had noticed a palpable spherical swelling on the back of his head at the base of his skull on the right side. In fact, the queen herself could see the swollen mass due to his beautiful bald head. She asked the handsome prince if he had any symptoms of a cold or sinus issue, like congestion or pressure in his ear. He said, "Why, yes, he had." The queen advised the handsome prince that it was most likely a swollen lymph node or lymphadenopathy related to his congestion. A little cold medicine and the brain tumor disappeared within 48 hours. The prince brightened considerably at this new diagnosis and lived happily ever after. The end. Recall that the lymphatic system functions to remove extra fluid from around the tissues. If this system fails, fluid accumulates in the tissue, leading to a specialized type of edema or swelling known as lymphedema. The fluid buildup is most common in the extremities and often is a result of a lymphadenectomy or removal of a lymph node after a diagnosis of cancer. For this reason, people who have had lymph nodes removed, particularly after a mastectomy, are advised to be very careful with the corresponding limb and even avoid having blood pressure readings or needle sticks on that side to prevent triggering lymphedema. Lymphedema massage is a special certification that can help relieve lymphedema in patients. Compression sleeves and stockings can also help reduce the swelling and discomfort. Our final complaint related to lymphatic system refers to pain in the system's largest organ, the spleen. Splenalgia or splenodynia both mean pain in the spleen. Often the pain will be most noticeable behind your left ribs. It can be caused by an enlarged, inflamed, or ruptured spleen. Either way, seek medical attention. As with all good things, this lecture too must come to an end. Thanks for exploring subjective terms related to the blood and lymphatic systems with me. See you next time. Salutations! Let's dive right in. In this lecture, we will discuss some common medical terms related to the blood or lymphatic systems that you might find in the objective portion of a clinic note. Recall that objective terms are those that the practitioner will observe or discover through labs and tests. They are used to describe what the practitioner finds in their examination. In the case of the blood and lymphatic systems, these practitioners making these observations might be a hematologist or immunologist who specialize in blood disorders and the immune system respectively. Blood samples drawn for lab analysis are done by technicians known as phlebotomists or specialists in drawing blood. The two main lymphatic system observations are lymphedema and lymphadenopathy. Since you're already familiar with them, this lecture will focus on observations related to the blood. The first observations and lab tests that a hematologist might order relate to the number of each type of blood cell. Let's take a look at what they might find. Hematopoiesis is the medical term for the process of forming blood cells. This occurs in the bone marrow in humans and is directed by chemicals specific to each blood cell type: erythrocytes, leukocytes, and thrombocytes. Perhaps the most common blood test is a CBC, or complete blood count. This basic test provides important information about the number of each type of blood cell in a blood sample. It's a good place to start the diagnostic process. So we know that a CBC is a complete blood count and that it tells us how many of each blood cell type can be found in a blood sample. But what if you have too many or too few of one or more types of cells? Erythrocytosis and oligocythemia are medical terms for too many or too few erythrocytes, respectively. The counterpart for leukocytes, leukocytosis, and leukopenia mean too many or too few white blood cells. Finally, thrombocytosis and thrombocytopenia mean too many or too few platelets in a blood sample. This information is also available from a CBC or complete blood count. But what if you have too many or too few of all three types of blood cells? It seems awful time-consuming to document that the patient has erythrocytosis, leukocytosis, and thrombocytosis. Graphospasm? Thank you, polycythemia and pancytopenia. These terms encompass all abnormal blood cell counts and mean too many or too few of all blood cell types. Much easier. Another part of a CBC is the hematocrit. The hematocrit is the ratio of red blood cells, or erythrocytes, to the total blood volume. It is done by spinning the blood sample in a centrifuge, which will cause the heavier erythrocytes to settle at the bottom of the sample. Normal hematocrit levels range from 41 to 50% in males and 36 to 48% in females. So, almost half of a given blood sample should be made up of those oxygen-toting red blood cells. That should make you breathe easier. Get it? Breathe easier? Oxygen-toting cells? Other common abnormal findings related to blood relate to their size and shape. Here are a few observation terms that you might see describing these abnormalities. Sometimes the abnormal findings are not about the number of blood cells, but rather their size. Macro and microcytosis refer to erythrocytes that are abnormally large or small, respectively. This is usually a sign of an underlying issue rather than a diagnosis itself. Yet other abnormal findings can refer to the shape of the blood cell rather than the count or size. Hopefully you have seen the image of a red blood cell enough to know that they should look like fluffy biconcave discs. If your red blood cells look like this football, we might describe them as an elliptocyte or an ellipse-shaped erythrocyte. We would not describe them as normal. Just as you do not want your fluffy erythrocytes to resemble a football, nor do you want them to resemble a football or American soccer ball. Sphere-shaped erythrocytes are aptly known as spherocytes and are also an abnormal finding. And now for a 10-second brain break. Look at the little goldfish. It's definitely looking at you. For the next part of our discussion, we are going to focus on observations related to platelet function or clotting. The first general term related to clotting is embolus. An embolus is a mass of matter in the blood. Why am I showing you a picture of a dirty sink after washing dishes that someone didn't scrape in the trash before dumping them in the sink? Well, because the different food particles floating in the dirty dishwater are like emboli floating in your blood. Both the food particles and the embolus are masses floating in what should be a pure liquid system. Closely related to an embolism is the actual blockage in a blood vessel caused by the embolus itself. Continuing with our analogy, you can see here that the floating food particles have completely blocked the drain strainer, thus effectively blocking the sink drain until it was removed. In the same way, an embolus, or mass of matter in the blood, can also clog the blood vessel and prevent blood flow to a tissue or organ unless it is removed. A thrombus is a specific type of embolus made up of blood cells. A blood clot, or thrombus, can be seen forming here as blood cells start to stick together and clump up in an abnormal fashion. If the thrombus or blood clot breaks free and starts to move through the bloodstream to another location, it becomes known as a thromboembolism. A pulmonary embolism is a life-threatening emergency when a thromboembolism travels into the lungs and becomes lodged in a pulmonary artery. This is very bad, and it is essentially cutting off blood supply to the lungs. Finally, there are some terms related to the blood and lymphatic systems that do not fit into any particular category, but are still important in interpreting objective findings. Here are a few with which you should be familiar. Our first term is antigen. An antigen is a molecule or molecular structure that can be found on the outside of pathogens, like bacteria or viruses, or other cells foreign to your body. In my simplistic mind, an antigen is like a pirate flag on a ship signaling that this is not something benignly intending to invite you in for tea and crumpets. The antigen is recognized by antibodies and triggers an immune response. This sets in motion a plan to destroy the foreign invader before it can harm your own cells and tissues. An antibody is something that the immune system makes to help fight off foreign invaders like bacteria or viruses. They do this by recognizing the antigens on the pathogen and then either marking it for destruction by other immune system cells or neutralizing it directly. Take that, bacteria from the floor put into my mouth by my niece who just started crawling and wanted to share a slobbery cracker. Immunoglobulins are special proteins made by the leukocytes that help the immune system fight off antigens. Immunoglobulins can be donated when you give plasma and then transferred to patients with immune deficiency disorders. Help save a life. Consider donating your plasma. Sharing is caring. Our next terms are perfusion and hypoperfusion. The term perfusion refers to blood flow going through a tissue or organ. As blood flow is key to delivering oxygen and nutrients and taking away waste and carbon dioxide, perfusion is critical to tissue and organ health. Hypoperfusion means inadequate blood flow through that tissue or organ, thus threatening its ability to function and stay alive. SOS, little tissue! And now for our word of the day, sphygmomanometer. This is one of my favorite medical terms and is useful to shout in public places when you slip on a wet floor and spill coffee all down your shirt. Sphygmomanometer! See? It works. Sphygmomanometer really means a device used to measure blood pressure. It might be the traditional gold standard cuff with a dial attached or a machine. As with all good things, this lecture too must come to an end. Thanks for exploring objective terms related to the blood and lymphatic systems with me. See you next time. Welcome. Thanks for joining me today. In this lecture, we will discuss some common medical terms related to the blood and lymphatic systems that you might find in the assessment portion of a clinic note. Recall that assessment terms are the diagnosis or differential diagnoses that the practitioner has decided upon after careful assessment of the subjective patient report and the objective findings. To help organize these terms, we will look at blood and lymphatic system terms separately. Up first, blood disorders. Diagnoses related to the blood can involve an infection, abnormal blood cell counts, or excess substances in the blood. Remember that anemia is a general term for not having enough erythrocytes or red blood cells. Aplastic anemia is a specific type of anemia that causes a low RBC or red blood cell count due to insufficient production. In aplastic anemia, the stem cells that produce the bone marrow are damaged and cannot make red blood cells. Just like this ATM has been damaged and cannot make cash. That's what ATMs do, right? Make free cash? While aplastic anemia is a low erythrocyte count due to an inability to produce them, hemolytic anemia is a low erythrocyte count due to premature destruction. The average lifespan of a healthy RBC is 120 days or around 4 months. If they are destroyed before then, the overall count will decrease as production can't keep up with the destruction. It's like trying to build a tower when your little sibling keeps stealing all the blocks. Futile. One specific cause of premature destruction in hemolytic anemia is spherocytosis. Spherocytosis is a condition that leads to your erythrocytes assuming a round or spherical shape rather than their fluffy biconcave disc. Round erythrocytes are like overfilled balloons. They are much easier to pop and destroy, thus leading to the decreased overall red blood cell count. Another type of anemia, iron deficiency anemia, is probably the most common and also readily treated. Recall that erythrocytes are big bags of hemoglobin made up of iron. If your body has an insufficient iron intake, your erythrocyte count will suffer. By increasing dietary iron intake, iron deficiency anemia can be corrected. So why do we have a picture of a floating hat? Well, if you've ever donated blood, you know that one of the first steps is a finger prick where they put a drop of your blood into that tiny container of fluid. If it sinks, you're good to donate. If it floats, like this hat in a sunny pool, or remains suspended, your blood is lacking iron and you are most likely anemic. No donation for you that day. Now that we've covered anemia, let's move on to some assessment terms related to clotting. Hypercoagulability means that an increased ability of the blood to clot. While we want our blood to clot to seal off damaged blood vessels, hypercoagulability can lead to the formation of thrombi or blood clots that can travel and include blood flow to tissues and organs. In fact, hypercoagulability is also known as thrombophilia, acknowledging its tie to thrombi. Thrombophilia is the opposite of hemophilia, where the blood is more likely to clot rather than less. Related to thrombi, a DVT or deep vein thrombosis is a blood clot that forms in a deep vein, usually in the leg. More common in the calf, it usually presents with pain, swelling, and redness in the leg. While the DVT itself is worrisome, the real concern is if it breaks free and travels to the lungs, where it could become a pulmonary embolism, effectively cutting off blood supply to the lungs. Patients with DVT should seek immediate medical attention to deliver thrombolytics or clot-busting drugs to prevent further damage. Hyperbilirubinemia means an elevated level of bilirubin in the blood. Bilirubin is a byproduct from the breakdown of worn-out red blood cells and is normally excreted. However, if the red blood cell breakdown rate exceeds the excretion rate, hyperbilirubinemia can result, creating the condition known as jaundice. Jaundice is characterized by a yellowing of the sclera or whites of the eyes and eventually the skin as well due to the yellow tint of bilirubin. Did you know that when a baby is born, they have to destroy all of their fetal hemoglobin in order to effectively extract oxygen outside of the uterus? It's true. The rapid breakdown can cause hyperbilirubinemia, which is why jaundice is so common in newborns. The ultraviolet or bili lights seen here actually help break down the excess bilirubin through the skin and alleviate the issue. They also have bili blankets that can go home with baby. Septicemia is a life-threatening condition where a bacterial infection, like the Staphylococcus aureus shown here, starts elsewhere like the lungs or skin, but then enters the bloodstream. Also known as blood poisoning, it then allows the infection to spread rapidly throughout the entire body, causing the immune system to trigger a widespread response and inflammation. The end result is occluded blood flow to tissues and organs and rapid tissue and organ death. This is a 911 situation. Leukemia is a general term for cancer of the blood or bone marrow. There are many specific types of leukemia, but they usually involve the white blood cells or leukocytes. Treatment includes chemotherapy. Our final terms for this section, hyper and hypovolemia, refer to an increased or decreased volume of blood respectively. Hypervolemia is also known as fluid overload and can cause swelling, high blood pressure, and even fluid buildup in the lungs. It's usually caused by heart or kidney issues. Hypovolemia is the opposite and can result in low blood pressure, low perfusion, and even circulatory collapse. It's usually caused by extreme dehydration or hemorrhage. So stay hydrated, but not overhydrated, and keep your blood in your body. Yeah, that's good life advice. Boy, I bet you're glad you're taking this course. And now for a 10-second brain break.
Oink, oink.
Sleep tight, little buddy. Lymphatic disorders make up the second half of our new terms. Most are related to lymph nodes, cancer, or the bone marrow. Our first lymphatic assessment term is autoimmune disease. This is a broad term for a class of disorders where the body fails to recognize its own cells and tissues and instead attacks them as foreign invaders. Examples of autoimmune diseases include things like rheumatoid arthritis and lupus. Splenorexis is the medical term for a ruptured spleen. Although this is a picture of a star explosion, I like the imagery. Boom! Spleen everywhere! Trauma like automobile accidents can cause splenorexis, and it requires immediate emergency medical attention. Inflammation of the lymph node is known as lymphadenitis. It can lead to a swollen lymph node as a result of the inflammation. Infections, bacterial and viral, can lead to angry lymph nodes or lymphadenitis. Lymphoma is a tumor of the lymphocytes and a general term for cancer of the lymphatic system. It begins in the lymphocytes or infection-fighting cells of the immune system. There are many different types and treatment will vary based upon a more specific diagnosis. Mononucleosis is an infection caused by the Epstein-Barr virus. It is transmitted in saliva and can cause fatigue, fever, and swollen glands. Treatment usually involves rest, fluids, and over-the-counter pain and fever-reducing medicines to ease symptoms until the disorder resolves. Because it is transmitted in saliva, mononucleosis is also known as mono or the kissing disease. So be careful how many frogs you go kissing trying to find that prince. More life advice. Man, I'm a great mom. Tonsillitis is an inflammation of the tonsils. It is caused by an infection and usually presents with a sore throat and fever. Treatment includes antibiotics if the infection is bacterial, as well as plenty of fluids, rest, and pain-relieving medications as needed. And ice cream. Don't forget the ice cream. A myeloma is a tumor of the bone marrow. Multiple myeloma is a cancer of the plasma cells found in the bone marrow. Symptoms include bone pain as well as weight loss and fatigue. As with other cancers, treatment includes chemotherapy along with other treatment options as needed. As with all good things, this lecture too must come to an end. Thanks for exploring assessment terms related to the blood and lymphatic systems with me. See you next time. Well, hello there. What brings you to lecture today? Oh, really? You want to know about medical terms related to how we treat blood and lymphatic system issues? Then you're in luck. That's this lecture. Yay! Recall that plan terms refer to the treatment or therapy that the practitioner has decided will best address the diagnosis from the assessment section. Sometimes the plan may also include further testing to rule out differential diagnoses or referrals to other practitioners to assist in clarifying an unknown diagnosis. Look how friendly this doctor looks. Hi, how may I help you with your hematological issue? The main treatment options for hematological or blood disorders are medications and transfusions. We will start by looking at some general principles and then progress to some more specific options. But first, our daily dose of cuteness. Aww. For erythrocyte disorders, it may be possible to fix the underlying cause, particularly in iron deficiency anemia. Increasing daily iron intake will usually remedy the low red blood cell count. However, if the root cause cannot be fixed or if the condition is severe, a blood transfusion can help. PRBC stands for packed red blood cells, which are the result of placing donated whole blood into a centrifuge and removing most of the plasma. These concentrated erythrocytes can then be transfused more quickly into the patient. Swell! If the blood disorder involves leukocytes, general treatment options also include attempting to fix the root cause. In the case of leukocytosis, treating the underlying infection that caused the increase in white blood cells can fix it. For more severe or complicated diagnoses, blood transfusions or even chemotherapy may be needed to wipe out the immune system and reset. An anticoagulant is a drug that prevents clotting and is also known as a blood thinner. On a basic level, aspirin is an anticoagulant. Perhaps you know someone who has been placed on a daily aspirin regimen to help prevent another heart attack or stroke. More potent anticoagulants include drugs like the one seen here that can be given as a daily injection. These medications are commonly given for several days after surgery to help prevent post-operative DVTs. If an anticoagulant isn't given or is not effective and a clot forms in your blood, a thrombolytic or clot-busting drug can be administered to try to break up the clot into smaller pieces that can pass with less damage. It's kind of like the chemicals you pour down a clogged sink or bathtub to try to break up the clog. I'm not sure what purpose the cat in the picture serves, though. Just kind of watching like a creeper. Opposite to an anticoagulant, a hemostatic medication is one that encourages clotting to stop blood flow. This can be useful in disorders like hemophilia or for patients who regularly take an anticoagulant but need surgery or have a severe injury where hemorrhage is possible. Hemostatics are also used in simple over-the-counter styptic pencils, which can help stop a nick during shaving from continuing to bleed. I remember my dad using one. Time to breathe and enjoy the great outdoors. Take 10 seconds. Treatments for lymphatic disorders generally involve surgical removal of the affected organ or lymph nodes. Removed tissue or lymph nodes can also be biopsied to direct treatment options. Our first surgical removal term is lymphadenectomy. As your stellar knowledge of medical terminology might have already told you, a lymphadenectomy is an ectomy of a lymphaden or removal of a lymph node. If you want to remove the largest organ of the lymph system, you will need to perform a splenectomy. But not really. You shouldn't remove any organ. Unless you're a licensed and board-certified surgeon, then by all means, proceed as medically necessary. To treat recurrent tonsillitis, sometimes a doctor will recommend a tonsillectomy or removal of the tonsils. This used to be a very common childhood procedure when the purpose of the tonsils was less well known or appreciated. Now, tonsillectomies are less common but still performed in certain cases. Finally, I would like to conclude this lecture with a look at several specific transfusion options that might be used to treat disorders of the blood and lymphatic system. Apheresis refers to a blood cleaning process. A patient's blood is removed from their body, has one or more components removed, and then the remaining components are placed back into their own body. This prevents the need for blood donors or transfusions as the patient serves as their own donor. How cool is that? Plasmapheresis is a specialized transfusion process whereby a person's blood is removed from their body, cleaned, and returned back to them. Specifically, the blood cells or solids are separated from the plasma or fluid, and then the solids are returned back to the patient. The plasma is not returned. This is a particularly useful option for people with autoimmune diseases, as the antibodies attacking the person's own tissues are removed along with the plasma. Cytopheresis is the opposite of plasmapheresis. Rather than filtering out the fluid part of the blood or plasma, it removes erythrocytes, leukocytes, or thrombocytes before returning the other blood cells and plasma back to the patient. This process can be useful in treating certain types of leukemia and thrombocytosis. Finally, platelet pheresis removes thrombocytes before returning the other blood cells and plasma back to the patient. This process can be useful in treating thrombocytosis or for harvesting platelets that can be donated to another patient. As with all good things, this lecture too must come to an end. Thanks for exploring plan terms related to the blood and lymphatic systems with me. See you next time. Hi, glad you're here. In this lecture, we will begin our exploration of medical terminology as it relates to the cardiovascular system. Let's get started. Without a doubt, this lecture has heart. Get it? Cardiovascular, heart. The cardiovascular system has two main parts, cardio, or the heart, and vasculo, or the blood vessels. Together, they are able to transport substances throughout the entire body. Fun fact, did you know that your heart pumps about 2,000 gallons of blood every day? And it can beat even when not attached to the human body. Amazing! It's slightly creepy. Let's begin by looking at the basic purposes and anatomy of the cardiovascular system. The cardiovascular system contains blood vessels that reach almost every tissue in the body and a heart capable of pumping blood through the entire network of vessels. This makes it an ideal transportation system. Nutrients and oxygen can be delivered rapidly anywhere and everywhere. Waste products are removed for excretion. Hormones also travel through the bloodstream, allowing for systematic communication and coordinated responses. In short, the cardiovascular system allows for transportation and communication. Roger that. 10-4, good buddy. Kabiri Niner, over and out. Let's start with a very basic look at the anatomy of the heart. The human heart has 4 chambers. The top 2 chambers are called atria, or the right and left atrium. That's the singular form. They are smaller and have thinner walls as compared to the bottom 2 chambers, or ventricles. The atria receive blood into the heart. The right atrium gets blood from the body, and the left atrium gets blood returning from the lungs. The right and left ventricle are responsible for pumping blood away from the heart. The right ventricle sends deoxygenated blood into the lungs to get oxygen, and the left ventricle sends the oxygenated blood out to the rest of the body. The heart also has 4 valves that make sure blood flows in only one direction, one way. You do not need to label their location, but do need to be familiar with the names and where they are located. The tricuspid and bicuspid valves separate the right atrium from the right ventricle and the left atrium from the left ventricle respectively. They are both known as atrioventricular valves because they separate the atria from the ventricles. Deep stuff. The pulmonary valve separates the right ventricle from the pulmonary artery, and the aortic valve separates the left ventricle from the aorta. Ta-da! The heart. At any given point in time, there are 2 circulation patterns going on simultaneously in the cardiovascular system, pulmonary and systemic. The pulmonary circulation takes deoxygenated blood to the lungs and then returns the oxygenated blood to the heart. Pulmonary circulation equals heart to lung to heart. The systemic circulation takes oxygenated blood from the heart to the body and returns the deoxygenated blood from the body back to the heart. Systemic circulation equals heart to body to heart. Working together, these 2 systems ensure a steady supply of oxygenated blood to the heart to send out to the body and a way to return deoxygenated blood from the body to the lungs. Putting it all together, here is the basic pattern of blood flow through the cardiovascular system. Deoxygenated blood from the body enters the right atrium of the heart. It then goes into the right ventricle where it is pumped out to the lungs for oxygen. From the lungs, oxygenated blood returns to the left atrium of the heart where it is moved into the left ventricle to be pumped out to the body. Repeat, 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 like a skipping record. The circulatory pattern repeats over 100,000 times a day. Do you even know what a record is? It's that thing in the picture. Ask your grandparents. Finally, there are 3 main types of blood vessels. Arteries take blood away from the heart. Artery and away both begin with the letter A. That should help you remember. Veins bring blood back to the heart, and capillaries are the teeny tiniest blood vessels where exchange of oxygen, nutrients, and waste between the blood and tissues occurs. And now for a 10-second brain break. Welcome back. Recall that the cardiovascular system contains the heart and blood vessels. We will look at new word roots pertaining to the heart first. Take heart. You can do it. First up, the most common roots for the cardiovascular system. Cardio and corono both mean heart, like the organ in your body, not the shape shown here. By the way, did you know that the Amorous heart shape has been around since 1250 AD? Useless trivia, but interesting. What is not useless is the knowledge that cardio and corono are both word roots for heart. Next up, atrio. Atrio means atrium, or one of the two upper chambers of the heart. The right atrium is indicated by the arrow shown here. Ventriculo means ventricle, or one of the two bottom chambers of the heart. The right ventricle is indicated by the arrow. The root valvo is a tough one. What could valvo mean? Heart? Leg? Armpit? Nope. Valvo means valve, as in the right atrioventricular valve or tricuspid valve shown here. Our final new word root related to the heart is septo. Septo means septum, or something that divides something in half. In the heart, the septum divides the right side of the heart from the left side of the heart. You also have a septum in your nose that divides your right nostril from your left. Septum, a divider of halves. In the previous section, we focused on word roots related to the heart portion of the cardiovascular system. The following section will focus on the roots for the blood vessels. The most general roots pertaining to blood vessels are angio, vaso, and vasculo, which all mean vessel. You can see them in words like angiogram, which is an image of the blood vessels, vasoconstriction, which is a narrowing of the blood vessels, and vascular, which means pertaining to the blood vessels. Much like the seaworthy vessel shown here, your blood vessels transport things all over the world. Your body. Our next word root refers to a specific vessel, the aorta. The aorta, shown here by the arrow, is the main vessel sending oxygenated blood out from the heart to the body. From the aorta, it will travel into the arteries. Aorta means aorta. Speaking of arteries, arterio means artery or the vessels that carry blood away from the heart. Remember that artery and away both start with A? Arteries are generally pictured as red vessels since most of them carry oxygenated blood. Flebo and veno both mean vein, or the blood vessels that carry blood toward the heart. They are generally pictured as blue vessels since most of them carry deoxygenated blood. Finally, the root athero means fatty plaque, as in the stuff that clogs up your arteries. It can be seen in the word atherosclerosis, and it can come from fatty foods like pizza. And no, making a pizza in the shape of a heart does not make it good for your heart. Sorry, but nice try. As with all good things, this lecture too must come to an end. Thanks for exploring introductory terms and roots related to the cardiovascular system with me. See you next time. Welcome. I'm glad you're here. In this lecture, we will discuss some common medical terms related to the cardiovascular system that you might find in the subjective portion of a cardiology note. Recall the subjective section contains things the patient reports. Patients will have complaints that can usually be categorized into problems with either the heart or circulation. Let's get started. We will start by looking at complaints about the heart. The first common complaint is pectoralgia, meaning chest pain. This is a broad term that does not necessarily relate directly to the heart. Acid reflux and lung issues can also cause pectoralgia. A more specific term for pain in the chest, angina or angina pectoris, is chest pain related to a heart attack. It is usually a sudden onset pain that can radiate down into the left shoulder and arm. If you or someone you love experiences angina, seek immediate medical attention. Hey, even if it's someone you don't love, seek medical attention. Be a good human. The next medical terms do not have to do with pain, but have to do with the heart's rhythm. Arrhythmia and dysrhythmia both mean an irregular heartbeat. This could be things like skipped beats, premature beats, or irregularly spaced beats. Arrhythmia and dysrhythmia does not refer to regular beats, just irregular ones. A palpitation is a rapid or irregular heartbeat. While there can be some overlap between arrhythmia or dysrhythmia and palpitation, a palpitation is usually rather short-lived. Palpitations can be due to emotional stress, caffeine or nicotine use, don't use tobacco, exercise, or illness. Palpitations can even be the result of a nice smooch from your spouse. And now for a 10-second brain break. In addition to these common heart complaints, sometimes patients will also complain about vascular issues relating to circulation. The first vascular complaint is aortalgia, or pain in the aorta. Recall that the aorta is the main vessel leaving the left ventricle of the heart and supplying oxygenated blood to the body. Aortalgia can be caused by different things, but the most worrisome is an aortic aneurysm, which can be life-threatening. Seek medical attention! Our next subjective term is diaphoresis, or profuse sweating. Diaphoresis does not refer to the normal profuse sweating common when exercising or from being outdoors in hot, humid environments. Rather, diaphoresis refers to profuse sweating as a result of an underlying disease, like cardiovascular disease or a heart attack, or a side effect from a medication. The final complaint related to blood vessels is phlebalgia, or vein pain. That rhymes! Vein pain. I got vein pain on the brain. Phlebalgia is making me insane. Perhaps if MedTerm professor doesn't work out, I could be a rapper or a lyricist. Phlebalgia can be caused by varicose veins, or veins that have been overstretched and weakened or damaged, or from the far more concerning DVT, or deep vein thrombosis. Varicose veins are common in people who spend all day on their feet, as well as women who are pregnant from the increased stress and strain on the system. Even athletes can get varicose veins. But athlete or not, compression stockings like the one shown here can help prevent phlebalgia from both varicose veins and DVT. Plus, they're a great way for individual expression. Win-win. Well, that's it for today. As with all good things, this lecture too must come to an end. Thanks for exploring subjective terms related to the cardiovascular system with me. See you next time. Hi everyone. What a beautiful day for medical terminology. In this lecture, we will discuss some common medical terms related to the cardiovascular system that you might find in the objective portion of a healthcare record. Recall that objective terms are those that the practitioner will observe or discover through labs or tests. They are used to describe what they find in their examination. With the cardiovascular system, this will involve the heart or the blood vessels. To begin, we will look at some common tests a cardiologist might use to examine the cardiovascular system. Basic examinations will include standard things like blood pressure, heart rate, and perfusion by checking the skin color. Blue, purple, or pale is bad. They will also listen to the heart with a stethoscope. The following slides discuss other heart tests and examinations. Blood pressure is a common assessment of cardiovascular health and measures the pressure on the arterial walls when the heart beats or contracts and when it relaxes. Blood pressure readings are represented as a fraction, like 120/80, which is a normal blood pressure reading in adults. The top number is called the systolic pressure and represents the pressure on the arterial wall when the heart contracts. The bottom number should always be lower and represents the pressure in the blood vessels between beats or when the ventricle relaxes. Note that the pressure is never 0 or the vessels would collapse. That's bad. To help you remember which number is systolic and which is diastolic, remember sky over dirt. Just like the sky is above the dirt, systolic is above diastolic. S over D, sky over dirt, or systolic over diastolic. An electrocardiogram is a record of the heart's electrical activity. It is performed using electrodes attached to the skin surface. An electrocardiogram, or EKG, can be useful in diagnosing arrhythmias, abnormal heart rate, and even help detect heart attacks. It is simple, non-invasive, and a common first-line assessment of the heart. A special type of EKG, a stress electrocardiogram, or stress test, records the electrical activity of the heart under stress, like during exercise. Also called an exercise stress test or a treadmill test, the electrodes will remain in place as the patient walks or jogs on the treadmill under increasingly difficult circumstances, like increased speed and/or graded incline. An echocardiogram is an image of the heart generated using ultrasound waves. This test can be particularly useful to check things like valve function and blood flow through the heart. I've had several in my life. Painless and pretty cool to see. A special kind of echocardiogram, a transesophageal echocardiogram, uses the esophagus to gain closer access to the heart and generate an image using ultrasound. These are usually performed under sedation and can be done as an outpatient procedure. A cardiac catheterization, or heart cath, is a procedure where a small catheter or tube is inserted through a blood vessel in the arm or leg and then guided by X-ray to the blood vessel supplying your heart muscle with blood. The catheter releases dye to create X-ray images of your heart valves and your blood vessels. This procedure can be used to check for heart disease and even treat blockages. Tiny balloons can also be inserted through the catheter and inflated during the cardiac catheterization to widen and open up blocked arteries. Cool! An angiogram is a way to visualize the blood vessels using X-rays, CAT scan, or MRI. Contrast can also be used to better visualize the vessels. Angiograms can help identify atherosclerosis or fatty buildup in the vessels, floating material or emboli, occlusions or dilation and weakening of a vessel. And now for a 10-second brain break. Wish I was on the beach. I'm so glad I'm in midterm. We will continue by taking a look at some common findings related to heart conditions. Fun fact! Did you know that the average human heart is about the size of your fist? Here's mine. How's yours? Cardiomegaly is the medical term for an enlarged heart. While it might be a compliment if someone tells you you have a big heart as you're ladling out soup at your local soup kitchen, it's a bit scarier coming from a cardiologist. Cardiomegaly can result from damage to the heart muscle like a valve issue or prior heart attack. Bigger than your fist, you might have cardiomegaly. The next abnormal finding is brady or tachycardia, meaning an abnormally slow or fast heart rate respectively. They are usually defined as less than 60 or more than 100 beats per minute or BPM. This could be the result of a heart arrhythmia, although bradycardia is completely normal in well-trained athletes. It's not uncommon for their uber-effective tickers to be able to get blood everywhere it needs to be at only 40-something beats per minute at rest. Wow! Cyanosis is a general term meaning skin with a blue tint. It is usually most apparent in the lips and fingertips or nails. Generally, cyanosis indicates poor circulation. This is common when out in extreme cold as the blood attempts to minimize heat loss by going deep into the core and away from the skin where it is more exposed to the cold. However, this can be a sign of underlying heart disease in normal temperature environments. Wait, do you hear that? It sounds like a murmur. It is a murmur, but not the kind we need to discuss. A heart murmur is an abnormal heart sound that is caused by abnormal blood flow through the heart. They can be heard through simple auscultation of the heart with a stethoscope. It can indicate valve issues, which are allowing blood flow backward through the heart, or valves that might have become stiff and tight. Please note that heart murmurs can actually be normal in children and women who are pregnant. In the adult non-pregnant population, murmurs are abnormal and deserve further investigation. Up next, medical terms related to findings concerning blood vessel conditions. Angiosclerosis is a general term that can be applied to any blood vessel. It refers to the fact that the walls of the vessel have hardened and are no longer pliable as in a normal vessel. Imagine trying to put air into a balloon or water into a hose that has become hard and brittle. It's not going to work well. I originally wanted a picture of an old worn-out hose, but instead found this picture. They look so happy together, and I couldn't resist including it. May we all still enjoy life as much at their age. And they could have angiosclerosis, so maybe this pic still works. We'll go with that. But they got their angiosclerosis fixed and lived happily ever after. A more specific term, arteriosclerosis, is the hardening of an artery. When an artery develops arteriosclerosis, it becomes less flexible and elastic, thus reducing its ability to deliver blood to the body. While rigid copper pipes might be great in a house, they're not so great for fluctuating pressure systems like the human body and can become damaged with increased pressure. Even more specific, atherosclerosis is arteriosclerosis caused by the buildup of fatty plaques in the artery. This comes from yummy foods like the funnel cakes and corn dogs at the county fair. And who thought of deep frying cookies? Wow! Unfortunately, cholesterol and other substances can accumulate in and on your artery walls. These plaques can cause your arteries to harden and narrow, restricting blood flow. The plaque can also break off and cause a clot. So, go easy at the county fair. And don't visit other counties and their fairs on a daily basis. Unless you walk. That might help offset the atherosclerosis. Aortic stenosis is the medical term for narrowing of the valve in the aorta. Also known as aortic valve stenosis, it keeps the valve from opening fully, reducing blood flow to the body and making the heart work harder. This can lead to a weakening of the heart and may eventually require a valve replacement surgery. As with all good things, this lecture too must come to an end. Thanks for exploring objective terms related to the cardiovascular system with me. See you next time. Greetings! Thanks for joining me. In this lecture, we will discuss some common medical terms related to the cardiovascular system that you might find in the assessment portion of a clinic note. Terms associated with assessment are used when the healthcare provider has gathered the patient's subjective information and his or her objective information. In the cardiovascular system, these can be broadly categorized into general or congenital diagnoses, heart diagnoses, and blood vessel diagnoses. Let's start with a look at the cardiovascular disease in general, as well as those with which you were born, also known as congenital diagnoses. Our first general diagnoses relate to blood pressure. Normotension means normal blood pressure. This is generally considered to be about 120 over 80 millimeters of mercury for an adult. Hypertension, or HTN for short, is elevated blood pressure. 140 over 90 is generally considered hypertensive. Finally, hypotension is low blood pressure, or anything below 90 over 60. Hypertension can lead to cardiovascular disease or stroke, while low blood pressure can lead to poor organ and tissue perfusion and/or dizziness and syncope, or even fainting. Myocarditis is an inflammation of the heart muscle. The most common cause of myocarditis is a viral infection. Often there are no symptoms associated with myocarditis in uncomplicated cases. If needed, medications and rest can help the heart rest while it recovers. A congenital heart diagnosis is one with which you were born. An atrial septal defect, or hole in the septum between the right and left atria, is an example of a congenital heart condition. In utero, there are actually several holes in the septum as cardiac circulation bypasses the lungs. After birth, when a baby switches to breathing air, those holes should close on their own. If they do not, an atrial septal defect may occur. This causes extra blood to flow through the lungs and can eventually damage lung blood vessels. Sometimes these defects will close on their own. If not, surgery may be needed. As with an atrial septal defect, a ventricular septal defect is a congenital heart diagnosis from a hole in the heart. However, the hole in a VSD, or ventricular septal defect, is lower in the septum between the right and left ventricles. A ventricular septal defect allows oxygen-rich blood to go back to the lungs instead of to the body, thus increasing the workload on the heart. Small VSDs may close on their own, but medium or large VSDs may require surgery. Up next, diagnoses specifically related to the heart. The pericardium is a thin lining around the heart. Beneath this layer is pericardial fluid, which serves as lubrication to allow the heart to beat in a relatively frictionless and smooth manner inside the sac. Pericarditis is an inflammation of the pericardium or sac around the heart. It can be caused by a viral infection or even a myocardial infarction or heart attack. Most mild cases resolve on their own, but more severe cases may require medication. And now for story time with Kabiri. Once upon a time, there was a young physical therapist who worked in the hospital. One day at lunch, she felt something rub on her shirt near her heart. She looked, but saw nothing, and went back to her meal. Later in the day, while writing her endless healthcare notes, she felt the sensation again and again. It was almost like when your seatbelt rubs against your shirt, but she wasn't wearing a seatbelt. The friction-y feeling persisted, and she finally went to the doctor. After an EKG ruled out myocardial infarction, she was diagnosed with pericarditis. Oral steroids were prescribed, and she had a full recovery, but she still had to deal with those endless healthcare notes. The end. Atrial fibrillation, or AFib as it is more commonly known, is a spontaneous and uncoordinated contraction of the atria. It can cause an irregular and tachycardic heart rate from the chaotic electrical signals. In AFib, the heart rate may go as high as 100 to 175 beats per minute, causing the sensation of a racing or flip-flop heartbeat, weakness, fatigue, shortness of breath, and even chest pain. Atrial fibrillation can be occasional, persistent, or permanent. Medications can be used to control atrial fibrillation. If those do not work, a catheter ablation can go in and attempt to burn off the misfiring heart cells. While ablations are often an immediate success, I have a family member who has had this condition and underwent 3 ablations. None of them worked, but medication is keeping it controlled. Cardiac arrest is the medical term for a cessation of heart contractions. Sometimes known as flatlining, there are no heartbeats recorded on an EKG. This is obviously bad and will require cardiac shock to attempt to restart the heart. Knowing how to safely and effectively use an AED, or automated external defibrillator machine, can literally be the difference between life and death for someone in cardiac arrest. If you aren't already, consider getting your CPR certification with AED training. You could save a life. While not immediately life-threatening, congestive heart failure is an inability of the heart to effectively empty all of the blood from the ventricles with each contraction as it should. This causes an overload of fluid in the lungs or extremities and further weakening of the heart. Prolonged, untreated hypertension can lead to congestive heart failure, which is why it is so important to manage your hypertension with your physician. Remember that ischemia is a term for reduced blood flow to a tissue. Myocardial ischemia is reduced blood flow to the heart muscle. This can cause the cardiac muscle to be oxygen deprived and cause angina or chest pain. Hypercholesterolemia, hyperlipidemia, and diabetes can all lead to blockages in the coronary arteries and cause myocardial ischemia. If myocardial ischemia continues to progress, it can completely cut off blood flow to the heart muscle and cause a myocardial infarction or heart attack. A MI results in death of the heart tissue from ischemia. Good news! You're not in cardiac arrest or experiencing a myocardial infarction. Rejoice! And now for a 10-second brain break. Finally, let's look at some additional diagnoses specific to the vasculature or blood vessels. One vasculature-related diagnosis is an aneurysm. An aneurysm is a general term for a bulging in the blood vessel wall due to weakness. Like an overfilled balloon, the walls of your blood vessels can experience focused spots of weakness, increasing the likelihood of a vessel rupture and hemorrhage. A more specific term, an aortic aneurysm, is an aneurysm in the aortic wall. Like a faucet about to burst, an aortic aneurysm is a potentially catastrophic situation if not identified before the rupture. As the main vessel supplying blood to the entire body, a ruptured aortic aneurysm has an overall mortality rate of over 80%. Unfortunately, most aortic aneurysms are symptomless. Fortunately, many start small and stay small, and some never even rupture. Another vascular condition, aortic regurgitation, is a backward flow of blood through the aortic valve and into the left ventricle. This becomes the case when the valve does not close tightly and allows leakage. This affects the overall efficiency of the heart and can make you feel short of breath or fatigued. Treatment can range from medications to aortic valve replacement. Fun fact! Aortic valves can be replaced with cow or pig valves. Vasculitis is a general term for inflammation of the blood vessels, often when the body's immune system attacks its own vascular system. This can be the result of an infection, medication side effect, or other disease. While I chose this picture because it shows the veins very well, please note that this is not how vasculitis presents. Symptoms of vasculitis include far more general things like aches and pains, headache, fever, and fatigue. Angioedema contains edema, which we know means swelling. Angioedema refers to rapid swelling just beneath the skin from excessive fluid accumulation. Angioedema is usually an allergic reaction. Finally, thrombophlebitis is an inflammation of a vein due to a clot. The affected vein can become red, painful, and swollen from the clot or thrombus. Most often, thrombophlebitis occurs in the calves. Not that calf, that calf. As with all good things, this lecture too must come to an end. Thanks for exploring assessment terms related to the cardiovascular system with me. See you next time. Welcome back. In this lecture, we will discuss some common medical terms related to the cardiovascular system that you might find in the plan portion of a healthcare record. Recall that plan terms refer to the treatment or therapy that the practitioner has decided will best address the diagnosis from the assessment section. In the cardiovascular system, treatment options usually consist of medication and surgery. For the cardiovascular system, medications can treat heart conditions, vascular conditions, or the buildup of fatty plaques that will treat both. Since angina means chest pain, an anti-anginal is the medication that is designed to go against or relieve chest pain. Sublingual nitroglycerin is a commonly prescribed anti-anginal. Dissolving under the tongue, it opens up the blood vessels so that blood can flow more easily to the heart, thus relieving the chest pain. Patients who have had a prior myocardial infarction, or MI, may be prescribed an anti-anginal like sublingual nitroglycerin that they can carry with them to provide temporary immediate vasodilation and prevent another heart attack until further medical attention can be obtained. To address blood that tends to coagulate too easily or is too thick, an anticoagulant or blood thinner may be prescribed. They might be given by injection for temporary and rapid use or orally for long-term or sustained use. Heparin and warfarin are all examples of anticoagulant medications. Patients on blood thinners must be cautious with activities where they could be at risk for internal or external bleeding, like contact sports, as these medications also increase the risk of hemorrhage. A cardiotonic is a medication that is used to help make the heart contract or beat with more strength or effectiveness. These medications are commonly used in diseases like heart failure, where the heart might have difficulty pumping all the blood that it should with each contraction. Fun fact! The cardiotonic digoxin is actually in this lovely purple flowering plant known as purple foxglove. Digoxin was one of the first cardiac medications. It was discovered to be beneficial in people with heart disease as early as 1775. Particularly helpful in people with heart failure and arrhythmias, this plant helped extend life for many people. However, purple foxglove is also highly toxic and should only be administered under the care of a trained physician. Foxglove poisoning has been responsible for the demise of many unsuspecting people throughout history who had it slipped into their food or drink unknown to them. In fact, some people think Van Gogh himself might have been a victim of foxglove poisoning. So, if your spouse starts a purple foxglove garden and then brings up your life insurance, beware! And chew carefully. An antiarrhythmic describes a class of medications that are designed to address arrhythmias or abnormal heart rhythms. They might be prescribed for conditions like bradycardia, tachycardia, or atrial fibrillation. A thrombolytic is a medication designed to break up a thrombi or blood clot. They are particularly useful in treating ischemic cerebrovascular accidents as well as myocardial infarctions and pulmonary embolisms. Why? Because they can break up the clot causing the blocked blood flow to the brain, heart, or lungs respectively. Thrombolytics are used for emergency medical intervention only. Perhaps one of the most commonly prescribed medications for the cardiovascular system is an antihypertensive. An antihypertensive is a drug used to treat hypertension or high blood pressure. There are many different antihypertensive medications with different mechanisms of actions. Beta blockers, ACE inhibitors, and calcium channel blockers are just a few classes of antihypertensives. Vasodilators are medications that open the blood vessels. Calcium channel blockers are antihypertensives that do so by serving as vasodilators. The opposite of antihypertensive medications and vasodilators are vasopressors and vasoconstrictors. These medications are used to increase blood pressure and constrict or narrow the blood vessels. Narrowing the blood vessels will automatically increase the blood pressure. In critically ill patients or those at risk of poor organ and tissue perfusion, vasopressors and vasoconstrictors might be used. And now for a 10-second brain break. That's better. For the cardiovascular system, surgeries usually address congenital heart defects or correct poor blood flow through the vessels, particularly the coronary arteries or vessels that supply blood to the heart. During surgery on the cardiovascular system, sometimes it becomes necessary to stop the heart to complete the repair. Also known as the heart-lung machine, the cardiopulmonary bypass has been around since the 1950s. This device allows the patient's blood to be pumped and oxygenated outside of the body, thus keeping other organs and tissues alive while the heart is repaired. It was a major medical breakthrough. Fun fact, patients have been successfully connected to cardiopulmonary bypass machines in excess of 500 minutes for cardiac surgery. That's over 8 hours without a heartbeat. Fascinating. Affectionately known as a CABG for short, a coronary artery bypass graft is a surgical procedure that uses donor vessels from elsewhere in the body to literally bypass a blockage in a coronary artery. It's like if your ditch gets clogged and you dig another ditch around the clog to allow the water to flow around the clog, or taking those side streets to get around a freeway clogged with a wreck. A bypass. The cardiopulmonary bypass machine might be used for this procedure. Good thing you know what that is. If you've heard the terms double, triple, or quadruple bypass, they refer to how many blockages were corrected or bypassed during the procedure. Speaking of open heart surgery, cardiothoracic surgery is the medical term for accessing the heart through the patient's chest. This requires the sternum, or solid bone connecting the ribs in the front of the chest, to be intentionally broken and wired together again after surgery. Also known as cracking the chest, it's not comfortable. However, I suppose it beats the alternative of doing nothing. Up next, valvectomy and valvuloplasty. Meaning removal of a valve and surgical repair of a valve respectively, these terms are listed together for a reason. They both involve heart valves. A valvectomy removes the valve. A valvuloplasty attempts to repair a valve, usually one that has an opening that has narrowed. Can anyone tell me which animals can donate heart valves to humans if they have a valvectomy? Did you say cows and pigs? Spencer, tell them what they've won!
Nothing. This isn't a game show. It's midterm.
Bummer. Sorry, guys. Cardioversion is the medical term for returning the heart to its regular rhythm. This is usually done by delivering an electrical shock, but can also be done chemically. The AED machines available at most public places are a portable first-line form of cardioversion. Clear! Another cardiovascular procedure, pericardiocentesis, is a puncture of the pericardium. This is usually done to remove fluid that is built up around the heart. This will remove pressure, chest pain, and shortness of breath. Analyzing the fluid can also help determine the cause of the fluid buildup as well. Nifty. Our next medical term relating to cardiovascular surgery is aneurysmectomy. It's usually a favorite term. Why? 1. It's super easy to break down and understand. It's an ectomy of an aneurysm. Duh. 2. It means that the aneurysm was removed prior to bursting and you're going to live! An atherectomy is the term for removal of a fatty plaque, as in the buildup in your arteries that can break off and form clots or impede blood flow, also as in these melting butter hearts shown here. Finally, an anastomosis is the creation of an opening between two normally separate structures. Why would we do that, and why is it in the cardiovascular plan? Well, sometimes an anastomosis needs to be made between an artery and a vein for dialysis. Also, an anastomosis can connect the graft and blocked blood vessel to create a bypass. See? It's relevant. Basically, it's making a hole to connect two structures. And no, they don't use a hole punch. I just used the picture to help you remember what an anastomosis is. As with all good things, this lecture too must come to an end. Thanks for exploring plan terms related to the cardiovascular system with me. See you next time. Welcome. Thanks for joining me today. In this lecture, we will begin our exploration of medical terminology as it relates to the respiratory system. Let's get started. The respiratory system is made up of your lungs and airways and is responsible for breathing. This allows oxygen into the blood and removes carbon dioxide. The branch of medicine that specializes in the respiratory system is called pulmonology. Let's begin by looking at the basic purposes and anatomy of the respiratory system. The process of respiration consists of two parts: inspiration, or breathing in, and expiration, or breathing out. Inspiration is an active process, meaning it requires energy to do so. The energy is needed to help the muscles of respiration contract and expand the thoracic cavity and rib cage, dragging the lungs along with them. Expiration under normal conditions is a passive process. No energy is required. Expiration is accomplished when the muscles of respiration relax and the lungs recoil to their original resting size, thus forcing air out. Speaking of active inspiration, the main muscle responsible for respiration is the diaphragm. This dome-shaped muscle lies just below the lungs. It compresses the abdominal cavity, or your squishy guts, when it contracts, pulling the lungs downward as they expand during inhalation. During exhalation, the diaphragm relaxes and resumes its dome shape as it moves upward and the lungs recoil to their smaller size, forcing air out. Although the spelling looks like diaphragm, it's actually diaphragm, but diaphragm is funner to say. When we think about the anatomy of the respiratory system, it can be subdivided into two main parts: the upper respiratory tract and the lower respiratory tract. Perhaps you or someone you know has been diagnosed with an upper respiratory tract infection. The upper respiratory tract consists of the nose, pharynx or throat, and the larynx or voice box. They are indicated by the arrows here in that order from most superior to inferior. We will continue by looking at each component of the upper respiratory tract in more detail. Yay! Up first, the nose. You probably already know that you have two holes going into your nose. Hopefully not because you've stuck your finger up there. The holes are commonly called nostrils, but the medical term is nares or nares. The septum is the divider between the two nares. The turbinates are folds that actually help circulate and swirl the air as it moves through the nose to warm, humidify, and clean the air before it moves further into the respiratory system. And the hairs? Well, they help trap dirt and debris. That trapped dirt and debris combines with mucus to become, you guessed it, boogers! Did you know that cleaning your nose responsibly,
Ew!
not like this, is a great way to stay healthy? So clean your nose, at home, alone, with a tissue, and then wash your hands. Fun fact, did you know that dogs don't have nose hairs like we do? I think that's why they don't have boogers. There's nothing to trap the dirt and debris to form them. Just goes right on up in there. That's probably a good thing because I had zero luck trying to teach my dog to use a tissue for responsible booger removal. Moving along in the respiratory system, the pharynx or throat is next. The pharynx can be further subdivided into the nasopharynx, oropharynx, and laryngopharynx. You might recognize the additional roots as describing the portion of the throat closest to the nose, mouth, and voice box respectively. And you would be correct. High five you. From the upper respiratory tract, the air continues down into the lower respiratory tract. The trachea or windpipe marks the first part of this subdivision. From there, the trachea divides into the right and left main bronchi, going to the right and left lungs respectively. The bronchi further divide into lobar bronchi to each lobe of the lung and continue to divide into smaller and smaller airways known as segmental bronchi and finally bronchioles. The final destination for air in the respiratory tract are the alveoli. The alveoli are air sacs where gas exchange between the lungs and blood occurs. They are thin, delicate structures covered in capillaries to facilitate the exchange of oxygen and gases through simple diffusion. The small circles at the end of the airways are alveoli. One alveolus is indicated by the arrow here. And now for a 10-second brain break. Doesn't that feel better? Back to the fun. For the next part, we will begin looking at new roots pertaining to the respiratory system. The first new roots related to the respiratory system are naso and rhino. They both mean noso. Just kidding, they just mean nose. The rhino pictured here is named for the horn on its nose. Rhinoceros combines the root rhino or nose with ceros, the Greek word for horn. More fun party trivia. I don't get out a lot. Pharyngo is the word root for the pharynx or throat. When you get an inflamed throat, we call it pharyngitis. You just call it sore. Laryngo is the word root for the larynx or voice box. Perhaps you've heard this term in the disorder laryngitis. Laryngitis is an inflammation of the larynx that causes you to lose your voice. I used to get laryngitis annually for a few days each year. It was like a holiday for my husband and kids. What, Mom? You want me to do what? Sorry, I couldn't hear you. Or my husband, honey, I love you so much. Let's spend hours talking about our feelings. Oh wait, you have laryngitis? Too bad. Our next new root is tracheo. It means trachea or the windpipe. The recorder shown here is another type of windpipe, but not a trachea. You should never drill holes in a trachea to change pitch. However, you can hear the root in the word tracheotomy, which is an incision into the windpipe to create an artificial airway. But just one hole will do. A sinus is a hollow space designated by the roots sino or sinuso. Most of us are aware of our sinuses when they become clogged with congestion and cause what is commonly called a sinus headache. But did you also know that they serve as your own built-in acoustics? Have you ever heard yourself on a recording and thought, that's not what I sound like? Or do you, like me, hate the sound of your voice on tape or video? Your sinuses serve as built-in acoustics, making you think you sound great, when in reality, you really might sound more like this. Pneumo, pneumato, and pneumono all mean lung or air. Obviously, the P is silent. Otherwise, it would be pneumo, pneumato, and pneumono. You can hear them in the words pneumonia, which is a lung disease, and pneumatic, like pneumatic tires, which are filled with air. Our next word root is pulmono, meaning lung. You can clearly hear it in the word pulmonologist, which is, of course, a specialist in the respiratory system. Recall that the trachea subdivides into a right and left bronchi, which supply air to the right and left lung respectively. The word roots broncho and bronchio both mean bronchi. Most of us have probably had bronchitis at some point. Now you know that it means an inflammation of the bronchi. As the bronchi continue to divide, they become little bronchi, or bronchioles. The word root for bronchiole is bronchiolo. I know, good luck memorizing that one. The smallest part of the respiratory system, the alveoli, are the sites of gas exchange between the lungs and the blood. Alveolo is the word root for alveoli. These new word roots both pertain to the portion of the skeletal system which protects the respiratory system. Sterno and costo mean sternum and ribs respectively. The sternum is the bone in the front of the rib cage which connects both sides. Somebody should really feed this patient. They're all bones. Thoraco, pectoro, and stetho all mean chest. You can see them as pictured here by the stethoscope, listening to the lungs in the thoracic cavity. The term breathe has a new word root and a new suffix. Spiro and pnea both mean breathe. You will sometimes hear the P pronounced in terms like dyspnea. A spirometer is a device used to assess the strength of your breathing muscles. Oxo means oxygen, while capno and carbo mean carbon dioxide. These gases are the driving force behind the need for a respiratory system, so it would only make sense that they get their own roots. Finally, here are a few other word roots you should know. Adenoido means adenoid, lobo means lobe, pleuro means pleura, and phreno means diaphragm. As with all good things, this lecture too must come to an end. Thanks for exploring introductory terms and roots related to the respiratory system with me. See you next time. Well, hello there. In this lecture, we will discuss some common medical terms related to the respiratory system that you might find in the subjective portion of a clinic note. Recall that subjective terms are those that the patient reports to the healthcare provider. They are the reason why the patient wants to see the pulmonologist. Most often, patients will come in complaining of a cough. Here are some other common respiratory complaints that might also bring someone to the clinic. These terms are not a particular diagnosis in themselves, but rather symptoms used to generate a forthcoming diagnosis. Up first, 4 medical terms all related to the breathing rate. A normal respiratory rate for an adult is 12 to 16 breaths per minute. This would be labeled as eupnea. If you have apnea, you are not breathing or your breathing has stopped. That's bad. Tachypnea would be abnormally fast breathing, and bradypnea would be abnormally slow. Hypo and hyperpnea mean shallow and deep breathing respectively. While this is usually abnormal, sometimes hyperpnea can be purposeful, like when using a party blower or taking a deep breath to blow up a balloon. Dyspnea also refers to breathing patterns, but rather than rate or depth, it refers to difficulty breathing. This can be pathological or a natural result of exertion. Commonly referred to as difficulty catching your breath, exertional dyspnea is normal with vigorous exercise. However, if you're just sitting on the couch binge watching a series, dyspnea is not normal. Seek medical attention. Orthopnea refers to an inability or difficulty breathing when lying down. In other words, you can only breathe well in an upright position. Most of the time, patients with orthopnea will report sleeping in the recliner or with multiple pillows under their head. Orthopnea is a classic sign of left-sided heart failure as well as other disorders which cause a fluid buildup in the lungs. Gravity helps keep the fluid at the bottom of the lungs in an upright position, thus improving ventilation. When the patient lies down, the fluid spreads throughout the lungs, making it more difficult to breathe. Orthopnea is not normal and requires medical attention. Hypo and hyperventilation take into account both rate and depth of breathing. Hypoventilation refers to breathing that is slow and shallow, while hyperventilation refers to deep and rapid breathing. I'm sure you've heard of someone hyperventilating before. Perhaps you or someone you were with experienced hyperventilation as part of a panic attack. As you might know or have noticed from the images, the home remedy for hyperventilation includes breathing into a paper bag. Why? The issue with hyperventilation, or breathing that is too rapid and deep, is that it actually causes your carbon dioxide levels to become too low. Breathing into a paper bag allows you to re-inhale some of the carbon dioxide you were blowing off, thus attempting to correct the imbalance. Fascinating. In addition to general complaints, some patients may complain about conditions related to the upper respiratory system, like rhinorrhea. Wait, what did the rhino have? No, rhinorrhea has nothing to do with rhinoceroses or their excrement. Thank goodness, no one wants to clean that up. Rhinorrhea is the medical term for a runny nose. Try that next time you don't want someone coming to visit. Stay away, I have rhinorrhea. I hope you don't faint at the sight of blood. If you do, don't look at this slide. Perhaps the medical field is not for you. But this slide is illustrating epistaxis or nosebleed. Epistaxis can happen as a result of dry air, a blow or strike to the nose, or even nose picking. If the nose just keeps on bleeding, we might prefer the term rhinorrhagia, which means an excessive flow of blood from the nose. Somebody get this person a clean tissue. And now for a 10-second brain break. Sometimes the patient will have complaints related to the lower respiratory system below the larynx. Here are a few that you might see or hear in clinic. Bronchospasm is an involuntary contraction of the bronchus. It is characterized by a cough with general wheezing and usually associated with asthma and bronchitis. Please note that this is bronchospasm with an H. This is bronchospasm without an H. It is a broncho having a full body muscular spasm while some rodeo star tries to hang on. Completely unrelated to med term. Although riding a bronco in spasm would surely give me bronchospasm. But I can't blame the horse. I'd buck too if someone tied a rope around me like that. Up next, another awesome medical term. Phrenospasm and singultus are medical terms for an involuntary spasm of the diaphragm, or hiccups. This annoying muscle spasm is usually harmless and resolves on its own. However, many home remedies exist, including drinking a glass of water, standing on your head, and having someone scare you. I personally just wait them out. Fun fact, the world record for the longest episode of singultus is 68 years. This poor gentleman hiccuped continuously from 1922 to 1990. That's a long time to wait it out. The pleura is a thin sac that encloses the lungs. It contains pleural fluid that lubricates the surface of the lungs and allows them to expand and recoil in a relatively frictionless environment. I think of it like a fancy plastic wrap around your lungs, with olive oil underneath. Pleuralgia and pleurodynia both mean pain in the pleura. Patients might complain about this in diseases like pleurisy. Thoracalgia is a general term that means pain in the chest. Sometimes this pain could be related to the respiratory system, although it is more commonly reported with cardiovascular issues. Expectoration is the medical term for coughing up and spitting out lung secretions. This is usually in the form of mucus. It is also my kryptonite. Give me flesh-eating bacteria and intestines on the outside of the body any day over expectoration. Even the sound makes me gag. You know the one. My personal issues aside, this is a normal part of the body's method of clearing secretions from the lungs and helping rid the respiratory system of contaminants. I just can't. Okay. I'm going to try to make it through this slide without gagging. I'm a big girl. Sputum is the name of the mucus coughed up from the lungs. It is the result of expectoration. It can range from clear to yellow to green depending on the presence of infection. Whew, there, I did it. If you're experiencing expectoration with blood in the secretions, you have hemoptysis. Coughing up blood is never normal and is a classic sign of lung diseases like tuberculosis caused by the bacteria shown here. Bronchorrhea is commonly caused by bronchitis and means a discharge from the bronchi. This usually means more than 100 milliliters per day of watery sputum. Finally, I would like to conclude this lecture with a subjective respiratory term that just might come in handy should you find yourself trying to avoid a particularly sticky situation. These terms are being provided for educational purposes only. Any use for personal gain, either real or imagined, is not being endorsed by this professor, this department, this university, or any of their affiliates. Use at your own risk. Our convenient excuse for the respiratory system is dysphonia, as in, sorry, Dr. Kabiri, I was going to take my medical terminology exam yesterday, but I got so distracted practicing my dysphonia, I just forgot. While it may sound like a musical instrument, dysphonia actually means a hoarse throat. No, horse with an A. That's better. That excuse for missing your test might work for another class, but not for med-term. Nice try, people. As with all good things, this lecture too must come to an end. Thanks for exploring subjective terms related to the respiratory system with me. See you next time. Look at you. You just keep showing up. Well done. In this lecture, we will discuss some common medical terms related to the respiratory system that you might find in the objective portion of a clinic note. Recall that objective terms are those that the practitioner will observe or discover through labs and tests. They are used to describe what the healthcare practitioner finds in their examination. For the respiratory system, these findings can be grouped into general findings, findings related to structures and tissues, findings related to blood gases, and special tests. We will start by looking at terms that refer to generalized findings like those from a physical exam. These might come from observation, palpation, or auscultation. Pectoriloquy is an increased resonance of the patient's voice through the lung structures as heard by auscultation with a stethoscope. The practitioner will ask the patient to whisper while listening to their chest. If the words are clearly transmitted instead of muffled, it indicates consolidation in the lungs, which might indicate a fluid buildup. Cyanosis is a condition where the skin presents with a bluish tint. It is usually most apparent in the lips, fingertips, or nail beds. Cyanosis is a sign of poor oxygen in the blood and tissue. I'm pretty sure the bluing of the skin seen here, though, is exaggerated. Retraction is a sign of respiratory distress. When the patient inhales, the skin around the ribs and thorax will suck in around the bones, making them appear exaggerated. This is from lack of air pressure in the chest, usually from blocked airways. If you ever see retraction, that person needs immediate medical attention. Recall that the sternum is the bone in the front of the rib cage connecting both sides of the ribs. These two medical terms relate to abnormal positioning of the sternum. Pectus carinatum results in a protruding sternum, like a mountain peak in the front of the chest. Pectus excavatum results in an abnormally deep sternum, like a valley. Both conditions are congenital, with pectus excavatum far more prevalent. Often, these conditions cause no problems, but may lead to shortness of breath or other respiratory symptoms in athletes or with vigorous exertion. As part of a respiratory exam, the practitioner might use percussion or striking of the surface of the chest to indicate the presence of air or fluid. Please note that this picture shows a nice gentle strike with the hands. This is what we want. This is not how you want your clinician to apply percussion to your chest, even if it has a great beat. We don't wail away on our patients, people. Some findings relate specifically to abnormalities in structures and tissues of the respiratory system. Special tests can help identify these abnormalities. Atelectasis is a serious medical condition meaning a partial or complete collapse of a lung. This is usually the result of the alveoli deflating and no longer being able to function. Symptoms include dyspnea, hyperpnea, and shortness of breath. Atelectasis can be caused by a blocked airway or by trauma. Pulmonary edema is a general term that means a buildup of fluid in the lungs. This fluid obviously makes it difficult to breathe, resulting in dyspnea. Remember that pulmonary edema is a symptom, not a diagnosis. It can result from many different disorders and diseases common to the respiratory or cardiovascular systems. While pulmonary edema is a buildup of fluid inside the lungs, pleural effusion is a buildup of fluid outside the lungs in the pleural space. The pleura is the sac which contains the lungs. Sometimes fluid will accumulate in this sac, causing anything from no symptoms at all to extreme dyspnea and a feeling of drowning. This condition is also known as water on the lungs. Basically, you have water in your lung sac. A hemothorax is a buildup of blood in your chest. Yes, I know you should have blood in your chest, but a hemothorax is when the blood builds up between the chest wall and your lungs. Eventually, enough blood can build up that it puts excessive pressure on the lungs, causing them to collapse. Blunt force trauma is the most common cause of hemothorax. A pneumothorax happens when air gets inside the chest, usually through a puncture or trauma. This air in the chest breaks the vacuum seal between the lungs and the thoracic wall and causes a partial or complete lung collapse. Sometimes the term pneumothorax will be used to designate a partially or completely collapsed lung due to air in the chest. I bet pneumothorax was a common cause of death back in the day. No wonder they developed chainmail suits for the nights. Aww. Don't let these terms badger you. Just take a 10-second brain break. Get it? It's a badger. This group of medical terms for the respiratory system relate to tests and findings regarding abnormal blood gas levels. Let's take a look. We all know that we exhale carbon dioxide. However, too much or even too little carbon dioxide in the body can cause problems. Hypercapnia and hypercarbia both refer to high CO2 levels, while hypocapnia and hypocarbia refer to abnormally low CO2 levels. Hypoxia is a general term that means insufficient or low oxygen levels. This may require supplemental oxygen like that shown here. Hypoxemia is a more specific term for low oxygen in the blood. It can cause shortness of breath and can be a sign of respiratory dysfunction. Oximetry can be used to assess hypoxemia. The little device with the glowing red light that's put on your finger is called a pulse oximeter. It addresses the oxygen saturation levels in the blood. Generally speaking, oxygen saturation levels run above 95% at rest and should remain above 90% even with activity. The final group of medical terms refer to special imaging and testing for the respiratory system beyond the typical X-ray or CAT scan. A ventilation perfusion scan, or VQ scan for short, is a test designed to measure air and blood flow through the lungs. This can help distinguish if the respiratory symptoms are related to an airflow or blood flow issue. It is done using special X-ray machines and can help identify things like a pulmonary embolism or even to check lung fitness prior to surgery. Polysomnography is the medical term for a sleep study. It records different aspects of sleep, including blood oxygen, heart and respiration rates, and even body movements. It is used to diagnose sleep disorders, including sleep apnea, or the cessation of breathing during sleep. A pulmonary function test, or PFT, is a non-invasive cluster of tests to evaluate lung function. Data points might include things like lung volume and capacities, flow rate, and gas exchange. They are particularly useful in diagnosing a wide range of pulmonary diseases. Spirometry is another test of respiratory function. Specifically, it tells you how much air you inhale and exhale, as well as how quickly you can exhale. These data points give the practitioner information about how well and effectively your lungs and muscles of respiration are working. The device shown here is a digital spirometer that connects to your smartphone. Cool. A bronchoscopy is a process that allows doctors to view the inside of your bronchi using an endoscope. During the procedure, a thin tube is inserted through the mouth or nose down into the lungs through the throat. In addition to providing a view of the lungs and airways, bronchoscopy can also be used to obtain biopsy samples and remove blockages. Nifty. As with all good things, this lecture too must come to an end. Thanks for exploring objective terms related to the respiratory system with me. See you next time. Hi, I'm so glad to see you. In this lecture, we will discuss some common medical terms related to the respiratory system that you might find in the assessment portion of a clinic note. Recall that assessment terms are the diagnosis or differential diagnoses that the practitioner has decided upon after careful assessment of the subjective patient report and the objective findings. They describe the diagnosis of the condition. To help organize the terms, they will be divided into upper and lower respiratory tract diagnoses. The most common diagnoses for the respiratory system involve an infection. The first group of terms pertain to diagnoses of the upper respiratory tract. Up first, laryngitis. Laryngitis is the inflammation of the larynx or voice box. It usually resolves on its own, but will cause you to lose your voice for a while. But don't worry, you can still text.
Phew.
Rhinitis is a general term for inflammation of the nose. This happens with colds and allergies and is characterized by a stuffy and runny nose. The nose may also turn red, but probably not this red. Sinusitis is another common upper respiratory tract diagnosis. Meaning an inflammation of the sinuses, you've probably had it yourself. Normally, the sinuses are filled with air, but they can become congested and clogged with diseases like the common cold. When the fluid and mucus remain trapped in the sinuses, it can easily become a breeding ground for germs and cause a sinus infection. Pansinusitis just means sinusitis of all the sinuses. Ugh. Another itis is tonsillitis, which is of course an inflammation of the tonsils. The tongue depressor shown here helps clear the line of vision for practitioners to visualize the disorder. Sleep apnea is the cessation of breathing during sleep. It can cause daytime sleepiness and is diagnosed by polysomnography. Fun fact, most people with sleep apnea don't even know they have it. It is usually noticed by a bed buddy, disturbed by loud snoring and even gasping or choking during sleep. This next group of medical terms pertains to disorders of the lower respiratory tract. Bronchitis is an inflammation of the bronchi, which are a part of the lower respiratory tract. Acute bronchitis is often called a chest cold, and it is the result of viral infections. Chronic bronchitis is caused by continual irritation of the airways from things like pollution and smoking. Symptoms of bronchitis include a productive cough with sputum that can be clear, white, yellow, or green. Pleuritis, also known as pleurisy, is an inflammation of the pleura or the sac around the lungs. It causes sharp pain in the chest that becomes worse with breathing as the inflamed pleural layers rub against each other. Causes include things like bacterial, viral, or fungal infections, as well as autoimmune disorders and lung trauma. Pneumonia is an infection of the lungs, specifically of the alveoli, that results in fluid building up inside the lungs. The alveoli become angry and inflamed and can fill with fluid or even pus, causing the characteristic productive, phlegmy, wet cough. Pneumonia can be caused by bacterial, fungal, or viral organisms. Usually the result of an allergic reaction, asthma is a condition caused by the constriction of the bronchi, making it difficult to breathe. Bronchoconstriction is actually an important protective reflex to avoid inhaling irritants that could potentially damage your lungs. Like when you accidentally inhale while lifting a powdered sugar-covered beignet to your mouth and end up choking. However, asthma is triggered by relatively non-noxious stimuli that would not normally cause a reaction in people without asthma. Pet dander, pollen, air pollutants, stress, and even physical activity or cold can trigger an asthma attack. This disorder results in a characteristic wheezing sound with breathing and is usually treated with an inhaler containing corticosteroids to promote bronchodilation. And now for a 10-second brain break. Emphysema is a lung disease that results from a loss of the elasticity in alveoli. They eventually weaken and rupture, thus reducing the surface area of the lungs, inhibiting optimal gas exchange. Emphysema is usually caused by long-term exposure to inhaled irritants, the top one being tobacco smoke. Please don't smoke! Your lungs will thank you. The term obstructive lung disease is a broad classification of lung diseases rather than a specific diagnosis. Obstructive lung diseases are those in which airways are blocked, making it harder to exhale or get air out. Symptoms include shortness of breath, particularly with exertion. Asthma, COPD, cystic fibrosis, and emphysema are all forms of obstructive lung diseases. One type of obstructive lung disease is COPD, or chronic obstructive pulmonary disease. COPD is actually a combination of lung disorders including emphysema and chronic bronchitis. These disorders lead to a continual blockage of the airways. The leading cause of COPD is smoking tobacco. There is no cure. Don't smoke, don't smoke, don't smoke, or vape, or huff, or maybe even don't breathe Houston air. Sincerely, your lungs. Cystic fibrosis is a genetic disorder that causes the thickening of all secretions in the body, including those in the respiratory system. The thickened mucus and secretions in the lungs are far more difficult to clear and can easily become a breeding ground for infection. Cystic fibrosis is usually diagnosed in infancy. Previously, most patients lived only until elementary school. However, recent advances in treatment have now extended life expectancy for people with cystic fibrosis into their 30s and 40s. A pulmonary neoplasm refers to a growth in the lungs. This growth is usually a tumor and might be benign or cancerous. A biopsy can be used to confirm if the neoplasm is malignant or not, and growth can be monitored using imaging. Mesothelioma is a particular type of pulmonary neoplasm that causes malignant tumors to form in the linings of the lungs or even the heart or abdomen. It is directly related to inhaling asbestos found in common construction materials like insulation. Unfortunately, this is an aggressive cancer with an average life expectancy of a year or less from time of diagnosis. Restrictive lung disease is another broad classification of diseases of the respiratory system. Opposite to obstructive lung disease, patients with restrictive lung disease have difficulty expanding their lungs, which makes it hard to get air in. Examples of restrictive lung disease include pleural effusion, pulmonary fibrosis, and even obesity and scoliosis, as shown here. As with all good things, this lecture too must come to an end. Thanks for exploring assessment terms related to the respiratory system with me. See you next time. Welcome! How's your day? Mine's swell. Thanks for asking. In this lecture, we will discuss some common medical terms related to the respiratory system that you might find in the plan portion of a clinic note. Recall that plan terms refer to the treatment or therapy the practitioner has decided will best address the diagnosis from the assessment section. Sometimes the plan may also include further testing to rule out differential diagnoses or referrals to other practitioners to assist in clarifying an unknown diagnosis. For the respiratory system, the plan usually consists of medications or surgical procedures. Sometimes medication is all that is needed to treat respiratory conditions like bronchospasm and coughs. We will look at these classes in more detail on the coming slides. First up, a nebulizer is a device that creates an aerosol form of a medication to allow it to be inhaled by a patient. Often referred to as breathing treatments, the nebulizer allows for direct delivery of medication into the respiratory system. Nifty. An expectorant is a medication that encourages the expulsion of secretions from the lungs. If you have ever looked at the back of a cold or flu medication package, it might list an expectorant. You only need an expectorant if you are trying to clear secretions from the lower respiratory tract. In other words, if you can feel congestion in your chest and you're trying to cough something up. A mucolytic is a medication that helps break down mucus. It is commonly combined with an expectorant as the two work in complementary ways. The mucolytic helps break down the mucus, and then the expectorant helps to clear it. You know what they say, teamwork makes the dream work. True in real life and in mucus removal. An antitussive is a medication that is used to prevent cough. You might see that term on the back of an allergy, sinus, or cold and flu medication as well. You only need an antitussive if you have a cough. Fun fact, honey proved just as effective as the leading over-the-counter antitussive medication in reducing cough in children ages 1 to 5 years old with upper respiratory tract infections in a clinical study. Yummy and effective. Perhaps most commonly prescribed to treat the bronchoconstriction or bronchospasm associated with asthma, a bronchodilator is a medication that expands the bronchi. This opens up the airways and relieves dyspnea. You might have seen someone using an inhaler during an asthma attack or proactively to prevent one. Odds are it contained a bronchodilator. And now for a brain break. Sometimes medication alone is not enough to treat a respiratory condition and a surgery or other procedure is necessary. These might include things like removing damaged or diseased tissue or placement of an artificial airway. The first procedure for the respiratory system is intubation. To intubate someone means to insert a breathing tube from the mouth to the trachea to provide breathing support. Patients are usually kept heavily sedated to prevent them from dislodging the breathing tube, as the discomfort can be highly agitating. Although this person doesn't seem to require any more sedation, they're almost lifeless as it is. The next procedure establishes an artificial airway that bypasses the upper respiratory tract completely. A tracheostomy is the creation of an opening in the trachea that allows for endotracheal intubation, or the insertion of a tube into the trachea to assist with breathing. These devices are for long-term or permanent respiratory support. A soft collar helps keep them in place, and special valve covers can act as an artificial larynx, allowing for modified speech. If needed, supplemental oxygen can also be delivered through the endotracheal tube. Cool. Like the brain, the lungs can be subdivided into lobes. The right lung has 3 lobes and the left has 2. Why only 2 lobes on the left? Because the heart is on that side, making the left lung slightly smaller. Removal of one of the lobes of a lung is called a lobectomy. It is quite possible to function just fine without a lobe. Beyond removal of a lobe, sometimes a disease will warrant the removal of an entire lung. This procedure is known as a pneumonectomy and is commonly used to address lung cancer if it cannot be contained to a smaller portion of the lung. But it's okay. You can live with 1 lung. And there are doctors that do this all the time. Like this guy. Yep, power pose on, O performer of pneumonectomies. Thoracocentesis or a thoracentesis is a puncture of the thorax or chest. It is done using a needle inserted into the pleural space between the chest wall and lungs. Fluid is then drawn or drained out to help remove excess fluid, most commonly associated with pleural effusion. The removed fluid can also be sent to the lab for culture to help determine the best course of treatment. It's like a tree tap, but for your lungs. And don't try to make syrup out of the drippings. Finally, although not a surgery, no discussion of respiratory treatment would be complete without covering CPR. Cardiopulmonary resuscitation is a method to provide artificial blood and airflow to a patient until further medical intervention can be obtained. If you have not ever taken a CPR certification course, please consider doing so. And if it's been a while, consider retaking. Guidelines and technology are updated regularly, and these skills can literally save a life. As with all good things, this lecture too must come to an end. Thanks for exploring plan terms related to the respiratory system with me. See you next time. Woohoo! 2 courses done and 1 to go for this specialization. Well done! In these 4 modules, we continued to learn medical terms related to additional body systems: endocrine, blood and lymphatic, cardiovascular, and respiratory. We reinforced our knowledge from Course 1 by breaking down new medical terms and continuing to emphasize proper medical term placement and information within a healthcare record. By now, you are an expert in course format and assessment and are ready to finish strong with Course 3, Brain, Nerves, Senses, Digestion, and Reproduction. I'm confident you will use your brain to digest the new information and reproduce your success from the first 2 courses. See you in the final course.